What's going on, world? What's up? What's up? What's up? How are y'all doing? How are y'all doing? Hopefully everybody's had a really good week. Today is Thursday, I think. Today's Thursday, y'all. Make sure you guys like, share, follow. You guys already know the deal. We are doing NCLEX questions today. Got these questions off nurseslabs.com. Sorry that I was not here yesterday. Your boy had physical therapy, got to fix this knee, got to fix this stuff that's going on. Hey, always take care of yourself, take care of your health, okay? Because you are A1 and always number one in your life, because we always know these other motherfuckers don't care about you. So, welcome. You guys, like I said, you guys already know what the deal is. We're about to do NCLEX questions. Make sure y'all smash that like button. Make sure you guys share. Make sure you guys follow. Those are the three things. Hey, those are the three things your boy needs, all right, in order to get it out to people, all right? So, of course, I got these questions off nurseslabs.com. What we doing today? Girl, we doing NCLEX questions, coming over here playing with me. You know what I'm saying? We do that all the time. Hey, so we're going to do Ask Me Anything after that. Also, make sure you guys go over, check out thebootnurse.com/special. Got a free download over there talking about testing strategies and all the good things that you need to know for NCLEX. It says, hey, Kevin, I bought the NCLEX, but I didn't get a chance to view it yet. That's okay. Hey, Jackie, so the great thing about the NCLEX course is that it is like you have it for a lifetime, so you can access it whenever you want, however you want. But like I said, and you get all the updates, you know what I'm saying? So that's okay if you didn't see it yet, but it'll be there for you. And if you have any issues with that, let me know. And also check your junk box or your junk email, because sometimes stuff goes in there as well. So pass my HESI, pending this week graduation, all thanks to your live, ma'am. That's what I'm talking about. Ariel, hey, send me an invite to graduation, girl. I'll come there virtually for you. You know what I'm saying? I always love to hear that. I love the support. I'm always here for it. I need help with HESI fundamentals. Look, ma'am. You right at the beginning, Bella. You right at the beginning. So, hey, I can help out however you want. Keep coming to these lives. Keep seeing everything I got going on. But you already know the deal. We got 100 folks up in here. Y'all keep smashing that like button, and we'll get this thing on and popping. We keep it on and popping. All right, here we go. How y'all doing? Hey, we're doing NCLEX questions real quick. Participation is the key. Make sure you guys like, share, follow. Don't be selfish your whole life. Hey, if you come into my chat and you act a fool, I'm going to ban that ass. Just letting y'all know. Nurseslabs.com is where I got these questions. Also, 7-day NCLEX course, $97. Also, there's a free download over there, guys, when you guys go over there and check that out. Also, I do one-on-one tutoring, and we're going to do an Ask Me Anything after this, all right? So here we go. Hey, here we go. Let me put y'all on a timer, too, because obviously you guys talk way too much. But here we go. Question number 1. A patient with Parkinson's disease has a nursing diagnosis of impaired physical mobility related to neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? So what did we as the RN see that the UAP was doing that was incorrect? Okay, the nursing assistant or the NA assists the patient to ambulate to the bathroom and back to the bed, reminds the patient not to look at his feet when he is walking, performs his complete bed, bath, and oral care, or sets up the patient's tray and encourages the patient to feed himself. So what are we thinking? Sweetie said, I took my NCLEX today. Thanks for your help. It stopped at 85. Ma'am, I can't wait. Hey, I can't wait for you to tell us what the results are. Hey, if you guys are new here, welcome. We got people coming in here telling me what the deal is, telling me that they passing classes, telling me that they taking NCLEXs, all that shit. And I am over the moon for all of y'all. I can't wait to see what the results are, all right? Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Hey, we need 10,000 likes. 10,000 likes, y'all. Hey, get carpal tunnel for me. Get carpal tunnel for me right now. All right. Oh, never mind. It's C. Hey, remember, read the question, y'all. RTFQ. This is why it's very important that you guys understand content and you guys read your questions. All right. Pass my dosage calculation with a 96. That's what I'm talking about, Tay. That's what I'm talking about. Hey, here we go, y'all. Here's our answer. Here is our answer in 3, 2. Oops, I lied. Here we go. And the answer is C. Performs the complete bed, bath, and oral care. The nursing assistant should assist the client or the patient with morning care as needed, but the goal is to keep the patient as independent and mobile as possible. That is part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. Okay, make sure you guys are paying attention. Make sure you guys are answering and participating. All right, that's how we get these things done. All right, here we go. Question number 2. The nurse is preparing to discharge a patient with chronic low back pain. Keyword, chronic. Think about chronic, okay? Which statement by the patient indicates that additional teaching is needed? All right. So what did the patient say that was incorrect that requires us as the nurse to re-inform them and educate them? Okay. I will avoid exercise because the pain gets worse. I will use heat and ice to control the pain. I will not wear high heel shoes at home or at work. I will purchase a firm mattress to replace my old one. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. They're free sets of questions. Right now, we're doing essentially a comprehensive RN exam, but these are also really great for LPNs as well. So I need for you guys to smash that like button. I need for you guys to share, and I need for you guys to follow. Okay, share it to somebody. Hey, if you're in nursing school right now, get it out to your other people that are in your cohort. Have them come over here, participate. You already know what we do. And Cass says that's too easy. Cass, what I done told you. You already know the deal. You already know what's up. Everybody is in a different stage in their life when it comes to learning about nursing stuff. All right, y'all. Here we go. Here is our answer. Here is our answer in 3, 2. And the answer is easy according to Cass. So it was A. I will avoid exercise because the pain gets worse. Exercises are used to strengthen the back, relieve pressure on compressed nerves, and protect the back from re-injury. Doing exercises to strengthen the lower back can help alleviate and prevent lower back pain. It can also strengthen the core, legs, and arm muscles. According to researchers, exercise also increases blood flow to the lower back area, which may reduce stiffness and speed up the healing process. Okay, that is part of health promotions and maintenance, which is 9 to 15% or 9 to 12%, depending on what you look at, but 9 to 15% on the NCLEX exam. Okay, it says boot camp also free for 3 months. You're talking about boot camp like for the Navy, because it is free, but it's for 2 months. But here we go. Here we go, y'all. Here we go. Question number 3. A patient with a spinal cord injury complains about severe throbbing headache that suddenly started a short time ago. Assessment of the patient reveals increased blood pressure of 168/94, a decreased heart rate of 48, diaphoresis and flushing of the face and neck. Which action should the nurse take first? So we already have our assessment. If we're doing ADPI, right? We already have our assessment. So we already have all the information. So what do? We need to implement. We need to do something, right? So what are we thinking? Is it A, administer the order to acetaminophen, check the Foley tube for kinks or obstruction, adjust the temperature in the patient's room, or notify the physician about the change in status? What are we thinking? Hey, make sure you guys smash that like button. Hey, we need 10,000 likes, y'all. We need 10,000 likes. Somebody said autonomic dysreflexia. Okay. Hey, I see you in there. Tatted Mom. All right, y'all. What are we thinking? Need y'all to smash that like button. Need for y'all to share. Need for y'all to follow. Get carpal tunnel for me. Stop playing games. Miss Melissa, how are you? All right, guys. People saying D. Saying D. This is where content really comes into play, ladies and gentlemen. So I have a spinal cord injury, right? This is where content really comes into play. You got to know it. There are no tricks to learning things about NCLEX. All right. There are no tricks about it. It's called putting in the fucking work. That's what it's called. All right. I'm good, Melissa. I'm good. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is check the Foley tube for kinks or obstruction. These signs and symptoms are characteristics of autonomic dysreflexia. All right, a neurological emergency that may be promptly treated to prevent a hypertensive stroke. The cause of the syndrome is noxious stimuli, most often a distended bladder or constipation. So checking for poor catheter drainage, bladder distension, or fecal impaction is the first action that should be taken. That is part of physiological adaptation. Somebody said why. I just told you why. That is why it is important. Content, questions and answers, and reading your rationale. The rationale will help solidify why the answer is correct as part of physiological adaptation. All right, which is the third largest section on the NCLEX exam at 11 to 17%. Okay, it's literally didn't say anything about a Foley. It definitely said the Foley was one of the answers. The Foley was definitely in one of the answers. It says check patient first, then notify the MD. Yep, you always assess before you do, but you already had your assessment, right? But it's still part of your assessment, okay? Always check the tubing before you call a code. Facts, because the doctor's going to come in there and be like, so did you check this? Do all SCIs require Foleys? Yes. All right, here we go. Question number 4. Which patient should you, as the charge nurse, assign to a new grad RN who is orienting to a neurological unit? So this is going to be most of everybody that's in this chat, right? Here we go. Is it a 28-year-old newly admitted patient with a spinal cord injury, a 67-year-old patient who with a stroke 3 days ago and has left-sided weakness, an 85-year-old dementia patient to be transferred to a long-term care today, or a 54-year-old with Parkinson's who needs assistance with bathing. What are we thinking? She just, C or D. Hey, give me an answer. Hey, give me an answer and run with it. This is why I love doing these questions, because it will allow for you to understand why you got it wrong, and it will let you know why you got it right. All right. Hey, if you guys are new here, I got these questions off nurseslabs.com. Make sure you guys go over there and check that out. Also, you guys can check out thebootnurse.com/special. I got a freebie over there for you guys talking about test taking strategies and all of those really good things that you need to know before you take your NCLEX exam. All right. Make sure you guys like, share, follow. We're on the road. Hey, 10,000 likes. Y'all get carpal tunnel from me. All right. B is more stable. Okay. Why is B more stable? So there's those key things that stick out to you on why it makes a patient more stable. Okay. Here we go. Here's our answer, y'all. Here's our answer. Remember, we have a newly assigned graduate RN, okay? So think about stable versus unstable. Do I want to give a new RN a stable patient or an unstable patient, right? So, and the answer is B, a 67-year-old patient with a stroke 3 days ago and a left-sided weakness, right? It says C is for a CNA, okay? And so it says a new grad RN who is oriented to the unit should be assigned a stable, non-complex patient, such as the patient with a stroke. Why? Because that patient is no longer acute. They had a stroke within the first 24 hours, whatever. They're still acute, but now they're 3 days past with left-sided weakness. Okay, somebody who had a stroke is to have expected signs and symptoms of having some type of weakness. That is part of management of care, which is the largest section on the NCLEX, ladies and gentlemen, at 18 to 23%. Okay, so here we go. Here we go. Question number 5. A patient with a spinal cord injury at level C, 3, and 4 is being cared for in the emergency department. What is the priority assessment? Is it A, determine the level at which the patient has impacted sensation? Is it B, assess the level at which the patient has retained mobility? C, check blood pressure and pulse for signs of spinal shock? Or D, monitor respiratory effort and oxygen saturation levels? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys go over there and check them out for yourself. Also, if you are a new nurse, new grad, or I'm sorry, not new grad, but a new nurse going to school, this is a really good place for you guys to get practice questions, as well as getting your nursing care plans, nursing diagnosis, your NANDAs, all that good jazz, okay? So make sure you guys go over there and check that out. Hey, 10,000 likes, y'all. Make it happen. 10,000 likes. We're already on question 5, y'all. We should already have 5,000 likes. Get carpal tunnel for me. Morgan, Isabella, appreciate the follows. Thank you. Here we go, y'all. Here we go with our answer. Here's our answer in 3, 2, and the answer is D. Monitor respiratory effort and oxygen saturation level. The first priority for the patient with an SCI is assessing respiratory effort or respiratory pattern and assuring an adequate airway. The patient with a high cervical injury is at risk for respiratory compromise because the spinal nerves innervated the phrenic nerve, which controls the diaphragm. So it's all about breathing, right? All about your respiratory rate, all about your airway, okay? So that is part of physiological adaptation, which is the 3rd largest section on the NCLEX exam, ladies and gentlemen, all right? Hold on one second. Somebody coming in here trying to be funny. Here we go. Hey, ladies and gentlemen, real quick, got these questions off nurseslabs.com. These are both for RNs and LPNs. Make sure you guys participate, smash that like button. Make sure you guys share, follow, need it all right? Don't be selfish your whole life. Hey, come into my chat, act a fool. I'm going to ban you. Also, 7-day NCLEX course. Hey, there's a freebie that's on this website. Make sure you guys go over there and check that out. Also, if you're looking for coaching, that links are in my bio. And we're going to do an Ask Me Anything to follow, okay? So here we go. Question number 6. You were pulled to the emergency department from the emergency department to the neurologic floor. Which action should you delegate to the nursing assistant when giving nursing care for a patient with a spinal cord injury? Is it A, assess the patient's respiratory rate every 4 hours? B, take the patient's vital signs and record them every 4 hours. C, monitor nutritional status, including caloric count. Or D, have the patient turn, cough, deep breathe every 3 hours. What are we thinking? What are we thinking? Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here? Hanging out with us. CNAs can't monitor or assess. Okay. All right. I'm going to give y'all 15 seconds. What are we thinking? What are we thinking? I'm Bella. Okay, Bella, we see you. I see you. First semester. Shout out to you, Kenzie. RN in the UK. Okay. All right. I see you out there. How did I test this? I don't know. How did you test this today? First semester. I'm a senior at university in Michigan, RN in Orlando, BSN in Jersey. I see you. Take vitals. Okay. Quarter 1, December 9 in the Philippines. Shout out to the Philippines. All right, y'all. Make sure you guys like, share, follow. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is B. Takes the patient's vital signs takes the patient's vital signs and records them every 4 hours. The nursing assistant is trained and educated to take a patient's vital signs, right? Because that is a task that is within their scope of practice. That is a management of care because we are delegating that task to a UAP. All right. The management of care, 18 to 23% on the NCLEX. And also, if you're an LPN taking your exam, coordinated care takes over for management care, okay, which is still the largest section on the NCLEX exam for PNs, okay? Here we go. Question number 7. You are helping the patient with an SCI to establish a bladder retaining program. What strategy may stimulate the patient to void? Select all that apply. So I should see all the answers down there. All the answers down there. Okay, so is it stroke the patient's inner thigh, pull on the patient's pubic hair, which is weird. Okay, but whatever. Initiate intermittent straight catheterization, pour warm water over the perineum, or tap the bladder to stimulate detrusor muscle. What are we thinking? Yes, spinal cord injury. A is weird, but NCLEX Hospital is also weird. NCLEX Hospital is very straight to the point. It's very straight to the point, and it's very perfect world. All right, when you're working out there, outside in the real world, the NCLEX world is not about that. Remember, the NCLEX is a standardized test. All right. So if you're an LPN and your state is saying like, yeah, you can do blood transfusions. No, you cannot on NCLEX. You cannot do that. It doesn't matter what your state says because the NCLEX is on a national standard. OK, national standard. I'm gonna give you guys 10 seconds. All right. Hey, if you guys are new here, welcome. We are on our road to 20,000 likes, ladies and gentlemen, 20,000 likes. Got these questions off nurseslabs.com. Make sure you guys go over there and check those out for yourself. They're free sets of questions, all right? What's up, farmer's daughter? Hey, how you go? Hey, how are those tests coming, all right? Are we over 59 yet? All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A, B, D, and E. All of the strategies except straight catheterization may stimulate voiding in a patient with a spinal cord injury. Okay. So, and it says right here, I'll read it right now since it's so big. It says, C, intermittent bladder catheterization can be used to empty the bladder, but it will not stimulate voiding. All right. Basic care and comfort. All right. Basic care and comfort, 6 to 12% on the NCLEX exam. Okay. All right, y'all, here we go. Good night. What you mean? Here we go. Question number 8. Question number 8. The patient with a cervical spinal cord injury has been placed in fixed skeletal traction with a halo fixation device. Paint the picture. If you've never seen what a halo fixation device looks like, I would recommend everybody Google what it looks like, okay? When caring for this patient, the nurse may delegate which of the following to an LPN, LVN, except for Bella. Select all that apply. Check the patient's skin for pressure from the device. Assess the patient's neurological status for changes. Observe the halo insertion device or sites for signs of infection. Or clean the halo insertion sites with hydrogen peroxide. What'd I say? I'm sorry. All the above. Brother pubic hair? Oh, yeah, that's wild. What you mean? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Hold on, y'all. Hey, by the way, if somebody comes into my chat and they start, you see like somebody's trying to like sell nudies. Why sell nudies when you can get them for free? All right. But anyways, if you see people that are doing that, hey, throw out 600 and they'll get blocked. Just let me know. All right. But what are we doing? 10 seconds, y'all. ABCs. Okay. All right, here we go. Spice, why wait? Just answer. Just give me an answer. I'd rather you give the answer and then we read the rationales. Hey, by the way, these questions came from nurseslabs.com, y'all. So, hey, the answer is A, C, and D. Hey, some of their answers may not be what you want, all right? But that's why reading the rationales is great for it to solidify in your head, all right? A, C, and D, all right? Checking the signs for pressures in the scope of practice of an LPN, as well as signs of an infection is within the scope of an LPN. And LPN also has the appropriate skills to clean a halo insertion device with hydrogen peroxide. That is part of management of care. Management of care, ladies and gentlemen, for the largest section on the NCLEX exam at 18 to 23%. So shout out to all of y'all who got that right. Shout out to all my LPNs, LVNs, except for Bella. Here we go. Question number 9. You are preparing a nursing care plan for the patient with an SCI, including the nursing diagnosis, impaired physical mobility, and self-care deficit. The patient tells you, I don't know why we're doing all of this. My life is over. What additional nursing diagnosis takes priority based on this statement? Is it risk for injury related to altered mobility, imbalanced nutrition less than body's requirements, impaired adjustment to spinal cord injury, or poor body image related to immobilization? What are we thinking? Hey, what's up, everybody? If you guys are new here, we are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button. Hey, we need 20,000 likes, y'all. 20,000 likes. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. Also, I want to know who you are, where you're from, and where you were at in your nursing journey. Michaela, thank you for the follow. And if you're not new here, what you doing here hanging out with us? Hey, also, if you're a patient care tech, a nursing assistant, a medical assistant, x-ray, physical therapy, occupational therapy, all y'all, I fucking love y'all. I'm telling y'all right now, we cannot do anything without y'all. And I wish that when I worked ICU that I had a patient care tech to help me out with stuff, because I'm telling you right now, shout out to all y'all. Especially, respiratory, I learned everything I needed to learn about the vent from a respiratory therapist. So shout out to all y'all that are out there doing God's work. You know what I'm saying? God's work. All right. And the answer is C, impaired adjustment to the spinal cord injury. The patient's statement indicates impairment of adjustment to the limitations of the injury and indicates the need for additional counseling, teaching, and support. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. But shout out to all of y'all, for real. Hey, and one other thing that you guys don't know about me is that I've been a nurse for 3.5 years, but I've been in the Navy for 16 years. And I'm on the downward slope. You know what I'm saying? I worked ICU, a burn, a neuro, and a medical ICU. I've worked PACU, and I've also worked OR. So here we go. Question number 10. Which patient should be assigned to the traveling nurse new to the neurologic nursing care who has been in the neurological unit for 1 week? Is it a 34-year-old newly diagnosed with multiple sclerosis, a 68-year-old with chronic ALS? Is it a 53-year-old with Guillain-Barré syndrome in respiratory distress, or is it a 25-year-old patient admitted with CA level spinal cord injury? Hey, so I said Guillain-Barré, and I always messed that up, and somebody was always correcting me, but it's like Guillain-Barré, and I'm just like, all right, cool, whatever. All right, y'all, what are we thinking? Everybody screaming B at me. Okay, all right. Hey, if you're new here, welcome. We're doing NCLEX questions. These are both for RNs and LPNs. I got them off nurseslabs.com. Nurseslabs.com. You guys can go over there and check them out. They have free sets of questions. Go over there and check them out for yourself. Get your learn on, all right? Make sure y'all smash that like button. 20,000 likes, y'all. Need all the shares, need all the likes, need all the follows, okay? I'm going to give you guys 5 seconds. No, I'm not. Here we go. Here's our answer in 3, 2, and the answer is B, a 68-year-old patient with chronic ALS. The traveling nurse is relatively new to the neurologic nursing and should be assigned to patients whose conditions are stable and not complex. That is management of care. Management of care, the largest section on the NCLEX exam. All right. Hey, if I have any travel nurses out there, and they know they're going to send you to a floor, you already know they're going to try to just railroad you. Anyways, here we go. Hey, real quick. Don't y'all go nowhere. Make sure you guys participate. We're doing questions, NCLEX questions for RNs and PNs. I need all them likes, them shares, them follows. Hey, 20,000 likes, baby. Hey, get carpal tunnel for me. Make it happen. Hey, don't troll my chat. You troll my chat, I'm going to ban you. And if you guys see like trolls or bots in there, let me know too, and we can ban them as well. Nurseslabs.com is where I got these questions from. Hey, 7-day NCLEX course, $97. You get it for a lifetime. There's a new generation NCLEX review in there. Also, if you go to my website, there is a freebie there for you guys to download talking about test strategies. Also, you need counseling, you need tutoring or anything like that. Check those links out in my bio. Also, we're going to do an Ask Me Anything to follow. All right, here we go. Question number 11. Is it a ma'am? Hi, how are you? He is great. Farmer's daughter. Hey, I appreciate you. You already know the deal. Hey, the patient with multiple sclerosis tells the nursing assistant that after physical therapy, she is too tired to take a bath. What is your priority nursing diagnosis at this time? Is it A, fatigue related to disease state, activity intolerance due to generalized weakness, impaired physical mobility related to neuromuscular impairment, or self-care deficit related to fatigue and neuromuscular weakness? All right. What are we thinking? Shout out to everybody that's in here answering these questions or participating. It says, been a nurse for 15 years. I still need help. That's okay. And that's a great thing. People have this notion that, hey, once you're a nurse, you know everything. I can tell you right now, this is a lot of stuff I learned from school. And I'm just like, whoa, I forgot. Right. Because we don't use these in the normal nursing world. OK, so you got to get a refresher, and there's nothing wrong with getting refreshers. There's nothing wrong with getting that. All right. So shout out to everybody that's in here. Make sure you guys smash that like button. Hey, 20,000 likes. 20,000 likes. Bella, you already know the deal. You are not doing your job, man. You know what I'm saying? I learn every shift. We learn new things every day. Hey, say that to yourself all the time. If you're a nursing student and you're having a rough time or you got humbled your first semester, that's okay. Learn new things every day. That is okay. And don't let nobody try to fucking tell you anything different. All right. We all learn things differently. We all pick up things differently. Okay. So I'm just letting y'all know, hey, I'm here to encourage and fucking motivate all of y'all to push. So stop playing games with me. All right, here we go. And the answer is D, self-care deficit related to fatigue and neuromuscular weakness. All right. At this time, based on the patient's statement, the priority is self-care deficit related to fatigue after physical therapy. Fatigue is described as an overwhelming feeling of lassitude or lack of physical or mental energy that interferes with activities. That is basic care and comfort, 6 to 12% on the NCLEX. All right, 6 to 12%, a smaller section, but a very, very important one because you never know if that section is going to put you over the top. All right. So shout out to everybody up in here. Hey, that's all I did. That's all we do is preach. That's all we do up in here. I want people to know what's up. Jeremy, why is it pointless? Why is it pointless? What is pointless, Jeremy? Before I ban you, I want to know what the hell you're talking about. Here we go. Question number 12. The LPN under your supervision, aka the RN, is providing nursing care for a patient with GBS. Know what GBS is, y'all. Okay. What observation would you instruct the LPN to report immediately? So if the LPN saw something wrong, they're going to be like, hey, nurse so-and-so or RN Kevin, this is what's going on and it needs your attention. Complaints of numbness and tingling, facial weakness and difficulty speaking, a rapid heart rate of 102, or shallow respirations and decreased breath sounds. What are we thinking? What are we thinking, y'all? It says, what's up? Dying on the Stairmaster. Hey, so you getting your learn on while you working out? Baby, that's what I'm talking about. I appreciate you. Hey, get those cardiovasculars on. Anticoagulant just joined. Welcome. We're doing NCLEX questions. Got it off nurseslabs.com. Hey, if you're new here, make sure you smash that like button. Make sure you guys share. Make sure you guys follow. 20,000 likes. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse or on a nursing journey, what journey are you on? What you doing with yourself? Thank you. I asked a few years ago and they said I couldn't take it. I feel I'm too. Oh, okay. I got you. Oh, no. You can always do whatever. You can get through anything if magic made it. I'm sorry. My bad. I'm just playing. The website is nurseslabs.com. All right, y'all. Here we go. And the answer in 3, 2. And the answer is shallow respirations and decreased breath sounds, right? GBS, Guillain-Barré syndrome, okay? Neurological issue. The priority intervention for the patient with GBS are aimed at maintaining adequate respiratory function. These patients are at risk for respiratory failure, which is urgent. Upon presentation, 40% of the patients have a respiratory or, oropharyngeal weakness. Ventilator failure and will require respiratory support occurs in up to 1/3 of patients at some time during the course of this disease. That is reduction of risk potential, which is like 9 to 15% on the NCLEX exam. So Guillain-Barré, look, hey, John, hey, does it look like I'm a 10-year-old that's trying to fucking be in a spelling bee? Absolutely not. So, if you're like a wordsmith police, person, then hey, bro, do you, bro. Do you? But I'm telling you right now, I will fuck that word up. Here we go. Question number 13. The nursing assistant reports to you, the RN, that the patient with myasthenia gravis has an elevated temperature of 102.2 degrees Fahrenheit, a heart rate of 120, and a blood pressure of 158/94, and was incontinent of urine and stool. What is your best first action? Keyword first. What is the first action? All right. Do I want to administer acetaminophen suppository, notify the healthcare provider, recheck vital signs in an hour, or reschedule a patient's physical therapy session? What do we want to do? All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. nurseslabs.com. Hey, if there's a word in here that you don't know what it means, make sure you got, hey, there's nothing wrong that Google can't teach you, right? And also, hey, people in the chat will answer those questions for you as well. But essentially incontinence meaning that you can't go, like it's like being constipated, like you can't poop and you can't pee. Okay. So what are we thinking? We got B's, okay, B. Got D, okay. Shout out to everybody that's in here. Welcome. We're doing NCLEX questions. Make sure you guys smash that like button. Hey, 30,000 likes. 30,000 likes. Hey, y'all, like on Monday, I had like 118,000 likes, y'all. Let's try to get back to that. Get carpal tunnel for me. Here we go, y'all. Here's our answer. What's up, Allison? Here we go in 3, 2. And the answer is you want to notify the healthcare provider immediately. The changes that the nursing assistant is reporting are characteristics of myasthenia crisis, which often follow some type of infection. The patient is at risk for inadequate respiratory function. In addition to notifying the physician, the nurse should carefully monitor the patient's respiratory status. The patient will need or may need intubation and mechanical ventilation. That is part of physiological adaptation, which is the largest section on the NCLEX exam. I'm sorry, the third largest section on the NCLEX exam at 11 to 17%. The largest section is management of care, all right, of 18 to 23%, all right? Appreciate all y'all with those likes and all those follows. You guys make sure you got, hey, if you're in school right now, share it to your cohort, all right? Stop being greedy, all right? Hey, nobody got anywhere by trying to gatekeep information. You know what I'm saying? No control, right? Here we go. You are providing care for a patient with an acute hemorrhagic stroke. The patient's husband has been reading a lot about strokes and asked why his wife did not receive alteplase. If I said that wrong, sorry. What is your best response? Is it A, your wife was not admitted within the time limit that alteplase is usually given? This drug is used primarily for patients who experience an acute heart attack. Alteplase dissolves clots and may cause more bleeding into your wife's brain. Or is it D, your wife had gallbladder surgery just 6 months ago and this prevents the use of alteplase? What are we thinking? Hey, neuro. If neuro is not your spot, definitely, take a look at it, Take a look at it. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys like, follow. Make sure you guys share to your cohort or share to your mom. I don't care if your mom doesn't like it. Just have her just watch it and smash the like button and get carpal tunnel for me. And also, if you start to get carpal tunnel, just tap it with your toes. You know what I'm saying? All right. Also, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. Samantha, are you telling me next as in like you want me to hurry up? I didn't know we were on your time. These are fun even as a qualified nurse. Always fun to refresh skills. Absolutely. Hey, a little bit about me, y'all. I've been a nurse for 3.5 years. I've worked ICU, I've worked PACU, and I've worked OR. I've been in the Navy for 16 years. I've been an instructor / educator for, it'll be 8 years in January. So, hey, shout out to Brazil. I see you out there, West Coast University. Okay, all right. From Jamaica. All right, I see y'all out there. Here we go, y'all. Here's our answer in 3, 2. And the answer is C. Alteplase dissolves clots and may cause more bleeding into your wife's brain. Alteplase is a clot buster, okay? With a patient who has experienced a hemorrhagic stroke, there is already bleeding into the brain. A drug like Alteplase will worsen the bleeding. That is part of pharmacological and parenteral therapies. This is why it is important, ladies and gentlemen, that you read your rationales. People are like, why not A? Well, the reason for A is right there. Okay, so make sure you guys read it. I'm not going to read the other portion of the rationales because that'll take too long. All right, but yeah, that's why it's important. You do content, you do questions with answers with rationales. What's up, Camille? How are you? Oh, I didn't realize that you were here. Camille, my bad. Sorry. Here we go. Question number 15. You are supervising a senior nursing student who is caring for a patient with a right hemisphere stroke. Which action by the student requires you to intervene? So what did the student do or say that was incorrect that we have to fix, right? The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. The student moves the patient's tray to the right side of her overbed tray. The student assists the patient with range of motion exercises. The student combs the left side of the patient's hair when the patient's combs only the right side. Sorry. So what are we thinking? Hey, appreciate everybody. Smash that like button. Hey, we're on the road to 30,000 likes. Hey, if you're new here, welcome, welcome. Got these questions off nurseslabs.com. These are NCLEX questions, both for RNs and LPNs. Doesn't matter which one it is. Biggest difference is that you need to know, as an LPN, you need to know what you can and can't do and what you can and cannot accept. Once you understand your scope of practice and rules and responsibilities, I could give you nursing and I can give you RN questions and you will shatter them just like you would shatter an LPN. Okay. It's all about knowing what you can and can't do. Jacob, I see you. I see you. Thank you for joining. All right, here we go. Make sure you guys smash that like button. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. I just joined BCS in nursing. Shout out to you. Shout out to you. All right. Hey, anybody that's about to start school in January, get your time management down now. All right. Because first semester is going to humble that ass. Trust and believe me. All right. But here we go. The correct answer is A. The student instructs the patient to sit up straight, resulting in the patient's puzzled expression. Patients with right cerebral hemisphere stroke often present with neglect syndrome. They lean to the left and when asked, respond that they believe that they are sitting upright or that they're sitting up straight. They often neglect the left side of their bodies and ignore food on the left side of their food trays. The nurse would need to remind the student of this phenomena and discuss the appropriate intervention, right? This is part of management of care, which is the largest section on the NCLEX exam, okay, at 18 to 23%. Who was supposed to teach me this? That's a good question. And you want to know what's crazy? Everybody in nursing school, they always say, hey, we're self-learners, blah, 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 blah. Why do I pay you all this money? If I'm a self-learner, you know what I'm saying? Hey, real quick, we're doing NCLEX questions. Got them off nurseslabs.com. Participate, share, like, 30,000 likes, y'all. 30,000 likes. Hey, if you guys are finding wealth and learning and getting value, make sure y'all smash that like button. That helps me out a ton, okay? Also, don't be rude. If you're rude, I'm going to ban you. If you rush me, I'm going to ban you. And if you start trolling, I'm going to ban that ass, okay? So just letting y'all know. Hey, at this website, which are linked, these two websites linked in my bio, you guys can go over there, check those out. 7-day NCLEX course is $97. Hey, there's a freebie on there for test taking strategies. All right. Also, if you're looking for one-on-one coaching for NCLEX, that is also over there as well. All right. Here we go. Nursing professors don't teach. That's true. They don't. They facilitate. There's a big difference. Which of the following arteries primarily feeds the anterior wall of the heart? Is it the circumflex artery, internal mammary artery, left anterior descending artery, or the right coronary artery? What are we thinking? What are we thinking? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. Welcome, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. Free sets of questions for you. Free sets of questions. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. Hey, another known fact about me, ladies and gentlemen, is that I failed my NCLEX 3 times. 3 times. All right. But guess what? Nobody in here would have ever known that unless I just openly, for the fact that I openly told you that. All right. So I'm just letting y'all know that, hey, it doesn't matter how many times you take that test. No job will care, no nothing. No job will care, no nothing. You can take it it depends on your state. Here we go, y'all. Here's our answer in 3, 2, shout out to Kansas. And the answer is C, left anterior descending artery. The left anterior descending artery is the primary source of blood for the anterior wall of the heart. The left anterior descending artery branches off to the left coronary artery and supplies blood to the front of the left side of the heart. That is physiological adaptation, which is the largest. So, oh my God, it is the 3rd largest section on the NCLEX, okay, at 11 to 17%. Bex, thank you for the flowers. Somebody else gave me flowers too. I didn't see that and I appreciate it. All right. Yeah. Hey, you can take the NCLEX as many times. Let me say it's state dependent on how many times you can take the NCLEX, okay? And Texas, you have 4 years to take it. But if you don't pass it in the 4 years, you then have to appeal at the Board of Nursing. In Florida, it's like 3, New York, and I think Ohio or places it's like unlimited. All right. But question 17, when do coronary arteries primarily receive blood flow? Is it during inspiration, diastole, expiration, or systole? What are we thinking? We're all over the place. Okay. Hey, if you guys are new here, welcome. Got these questions off nurseslabs.com. Make sure you guys like, share, follow. Give me them likes. Give them to me. A, no clue. That's fine. And if you don't know, that's okay. A lot of these things we forget, like who thinks about, oh yeah, the coronary artery and, it goes here and it goes there. Sometimes you forget these things, out of sight, out of mind type deal. Okay. Here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is during diastole, during the coronary artery, or through, I'm sorry, although the coronary arteries may receive a minute portion of blood during systole, most of the blood flow to the coronary arteries is supplied during diastole, which is physiological adaptation. Third largest section on the NCLEX, 11 to 17%. All right. Appreciate everybody stopping by. We're doing NCLEX questions. Make sure you guys like, share, follow, smash that like button. That is what, this is what helps get it out to people. And this is what TikTok loves. So I need attention. Make it happen for me. Okay. Question number 18. Which of the following illnesses is the leading cause of death in the United States? So if you guys don't live in the United States and you guys don't know, that's okay. This is our problem and we're going to fix it. Okay. Is it cancer, coronary artery disease, liver failure, or renal failure? What are we thinking? What are we thinking, y'all? What are we thinking? Camille says plaque. Okay. Patricia says A. All right. All right. All right. But yeah, I failed my NCLEX 3 times, y'all. First was 75 questions. Second time was 265 questions. Third time was 106 questions. And then I passed right around COVID time at 60 questions. All right. When they got rid of the research questions. So I'm just letting y'all know it doesn't matter what y'all go through. Trust and believe me. Trust and believe me. It doesn't matter what y'all go through. The fact that you're unsuccessful at certain things will build upon you to be a great, not just a great nurse, but a great fucking person. All right. Trust and believe me when I tell you. And no job, no recruiter, nobody will ever ask you, hey, how many times did you fail? No, we ain't going to have you. Not a thing. All right. Here we go. Here's our answer in 3, 2. How many times did you take it? I took it 4 times and I failed it 3 times. All right. But the answer, of course, is somebody said fast food. So coronary artery disease. It accounts for over 50% of all the deaths in the United States. That is health promotions and maintenance, which is like 9 to 15% on the NCLEX exam. M says I graduated in a week. I'm petrified of this. Why? Hey, if you're scared, go to church. Don't be scared of the exam. If you prepare for it, just like think about it on a professional athlete standpoint, they prepare their entire lives. And then they practice all the time in order for them to go to show out for 4 hours or 3 hours at a professional football game. You know what I'm saying? Think about it like that. Practice like that and prepare like that. And you're going to be fine. Which of the following conditions most commonly results in CAD? Is it atherosclerosis, diabetes, MI, or renal failure? Everybody's saying A. Oh, I see some A's up in here. Okay. But yeah, I've had people tell me they was like, oh my God, I can't believe you failed it. Or I've had people say, well, I would never let you take care of me if you failed, if you can't pass an exam. And I'm just like, all right, Susie, what's this fuck? Like, if you want to like determine for the fact that I didn't do well on an exam, but I'm a great fucking nurse, then okay, whatever, bro, go do you. Hey, a doctor that finished last in his class is still a doctor. Am I right? You know what I'm saying? Hey, and I say the F word a lot. Mostly it's because I'm a sailor and I'm trying to get my life together. But if you don't like the F word, it's going to be hard. It's going to be hard for you to be a nurse because a nurse's favorite word is the F word. I think everyone's favorite word is the F word. It don't even matter what language it's in, right? And the answer is A, atherosclerosis, right? Atherosclerosis or plaque formation is the leading cause of coronary artery disease. That is physiological adaptation, which is the third largest section on the NCLEX. Never had a patient ask me about NCLEX, and you never will unless they're a nurse. If I was your patient, I would be like, hey, how many times did you take that NCLEX? You'd be like, wait, who are you? And are you a mole? You know what I'm saying? So. All right, here we go. Question number 20. Atherosclerosis impedes coronary blood flow by which of the following mechanisms? Look at that. Plaque obstructs the vein, obstructs the arteries, blood clots form outside the vessel walls, or hardened vessels dilate to allow the blood to flow through. There we go. How many times you take it till I How many times you take it till I pass? Oh, it depends on you. How many times you're going to study effectively until you pass it, right? Everybody, hey, look, let me tell you something right now. Everybody's destination is the same. Your destination is to get your license. Your journey to get there, well, that's a different story. That's a different story, all right? All right, y'all, here we go. Jody, thank you for the follow. Appreciate you. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is plaque. Plaques obstruct of the arteries. Arteries, not veins, supply the coronary artery with oxygen and other nutrients. Atherosclerosis is a lipoprotein-driven disease that leads to plaque formation at specific sites of the arterial tree through, an intimal inflammation, necrosis, fibrosis, and calcification. That is part of physiological adaptation. I see her. I see the bot. We're good. Hold on one second, y'all. Confirm. I don't want you on here. Stop trying to sell me nudies, miss. God, go away. Yeah, so there's that. I forgot what I was saying. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. Hey, I've done some cases where we've taken out like plaque from a patient, like in the vascular clinic. And let me tell you something. Think of a marble and dropping it on the floor. That's what it sounds like, and that's what's inside your body because of all the plaque buildup. It's gross. All right, hey, we're doing NCLEX questions. Make sure you guys participate. Follow. Hey, 30,000 likes, y'all. 30,000 likes. Okay, make it happen. Let's make it happen right now. Share, follow, give me all them likes. Don't be selfish. If you come to my chat, try to sell me nudies, you try to be rude, you try to rush me, I'm gonna ban you just like that. Nurseslabs.com is where I got these questions. Make sure you guys check out the 7-day NCLEX course. Hey, at this website, there's a freebie. Go check it out, test taking strategies. Also, we're gonna do an Ask Me Anything to follow. All those links are at my bio right here. Right there. There we go. There we go. Which of the following risk factors for coronary artery disease cannot be corrected? Is it cigarette smoking, diabetes, hereditary, or hypertension? See. Nikki says, Kevin, you are awesome, ma'am. Thank you. You are awesome. I appreciate you being here. Who said something? Gabriel says they have a lot of good stuff, even care plans. Exactly. I tell everybody that's a new nurse, hey, go over there and check that out. Like I was using them religiously when I was in school to learn how to write care plans. All right. Hey, if you guys are new here, welcome. Welcome. I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse or on a nursing journey, what you doing here? Listen to me rub my mouth. Can't change hereditary. Psh, yeah, we can. No, let me stop. Ohio. Okay. Shout out to you, Nikki. What do you think about residency programs? I think residency programs are great, but in my humble opinion, they need to be extended. Shout out to, is it Katrina? Shout out to the Philippines, Katrina. Shout out to Texas. Hey, I live in San Antonio, you know what I'm saying? I love it out here, you know what I'm saying? I love Texas. I'm a Texas boy all through and through, you know what I'm saying? MP or PA, depends on you. I'm not doing either. So, but MPs are now have more independence, depending on what state you are, than a physician's assistant. All right, but hey, it's hereditary because hereditary refers to our genetic makeup and it can't be changed. That is health promotions and maintenance. That is 9 to 15% on the NCLEX exam. Shout out to Oklahoma, but go Horns, but whatever. We're not going to talk about that. I'm moving to San Antonio when I graduate in May. Kimball, shout out to you. Hey, Kimball, if you're moving to San Antonio and if you're trying to get a job as a new grad, I'm telling you right now, you want to go to University Hospital. You want to go to university, level 1 trauma facility. You have everyone and everything. Don't go to these other hospitals. I'm telling you, hindsight. I'm telling you right now. Question 22, exceeding which of the following serum cholesterol levels significantly increases the risk for coronary artery disease? Is it 100 milligrams, 150, 175, or 200? And the reason why I say go to University Hospital or anybody to go to a level 1 trauma facility is because they are teaching hospitals. They are teaching hospitals, and just trust me. Listen to me when I tell you this, okay? Oh my gosh. I appreciate y'all being in here. I want to know who you are, where you're from, where you're at in your nursing journey. Also, we're going to 40,000 likes. I need for y'all to get carpal tunnel for me. You want to know why? Because I do it for you. I would. I really, really would. All right. All right. Is it Calgary? Is that in England? That's in England, right? Or not England, but in the UK. See, like my geography is all off. If I said it, I'm sorry. Natalie got a pennant ceremony on Monday. Shout out to you, Canada. Oh, damn it. See, look. I'm sorry. Look, I'm gonna get right. Hey, look. I'm gonna ban all of y'all if y'all keep laughing at me. Okay? No, I'm gonna get right. I promise. I'm gonna get right. Australia. Shout out to Australia. All right, y'all. Here we go. And the answer is 200 milligrams. Cholesterol levels over 200 milligrams are considered excessive. I promise I'm not gonna ban nobody. Unless you act up. They require dietary restrictions and perhaps medication. Exercise also helps reduce cholesterol levels. The other levels listed are all below the nationally accepted levels for cholesterol and carry a lesser risk for coronary artery disease. And the normal level of serum cholesterol is within 125 to 200 milligrams per deciliter. That is reduction of risk potential 9 to 15% on the NCLEX. We love this life class. Hey, that's what I'm talking about. Hey, if you love this live class, get me to 100,000 likes. I'm a janitor. Hey, if you're a surge tech, you are also a janitor. I'm just letting y'all know right now. Question number 23. Which of the following actions is the first priority care for a client exhibiting signs and symptoms of coronary artery disease? Is it decrease anxiety, enhance myocardial oxygenation, administer sublingual nitroglycerin, or educate the client about his symptoms? What are we thinking? I'm going to give you guys about 30 seconds. I feel like I'm going kind of fast right now. So I actually am going really fast. So what are we thinking, y'all? What are we thinking? Hey, if you guys are new here, welcome. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Hey, if you are in nursing school right now, share this to your cohort. Share it to your cohort. Hey, and if you are preparing for the NCLEX, go check out the 7-day NCLEX course. That link is in my bio. It's $97. You get it for a lifetime. And I have a new generation NCLEX review in there. It spans over 4 hours. I go over 100 questions. I leave some tips at the end. Go check that out. Stop playing games with me. Do it because you love me. All right. All right, y'all, here we go. What are we thinking? What are we thinking? I have an exam tomorrow on this CAD. Shout out to you, Queen. Hey, hopefully this is helpful. You to go, LVN. I appreciate you being here. Y'all are the goats for being here. Listen to me run my mouth. All right. Hey, 40,000 likes. That's where we're going. That's where we're going. Here we go. Here's our answer in 3, 2. And the answer is B, enhance myocardial oxygenation. Enhancing myocardial oxygenation is always the first priority when a client exhibits signs and symptoms of cardiac compromise. Without adequate oxygenation, the myocardium suffers damage. That is part of physiological adaptation, which is what? It is the third largest section on the NCLEX, ladies and gentlemen, at 11 to 17% on the NCLEX. I'm telling you, there are three, I call them the big three: management of care, pharmacology, physiological adaptation. They make up 44 to 49% of the entire exam. If you can master within those sections, the chances of you being above the passing line it's phenomenal. All right. So make sure that is how you practice. All right. Understanding where they come from, doing your content, answering your questions, doing your rationale. Stop playing games with me. What time do you do these? I do them at 5:30 Central Standard Time, Texas time, because that's the only time that matters. I'm just letting you know. Shout out to Texas. Here we go. Question 24. Medical treatment of coronary artery disease includes which of the following procedures? Cardiac catheterization, coronary artery bypass surgery, oral medication administration, or percutaneous transluminal coronary angioplasty. What are we thinking? These are a mouthful, y'all. These are a mouthful. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com, free sets of questions. Make sure you guys go over there and check those out. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here? I had a janitor that was in here. Hopefully they're still in here, hanging out with us, doing janitorial things, whatever. Yeah. Also, another little thing about me. I've been deployed. I've been to Afghanistan and I've been to Guantanamo Bay. I've been a surgical tech in the Navy as well as a master instructor and essentially what we call a hospital corpsman. They're like LVNs. So I'm just letting y'all know. I've done a couple things around the world. You know what I'm saying? Done a couple things around the world. You should do a voting on each question. I should, but y'all are impatient and I'm impatient to try to figure that out. But I'm gonna get that taken care of. Matt, appreciate your support. Thank you. Here we go. Here's our answer in 3, 2. You're a CNA. Shout out to you, Gina. I'm a corpsman. What's up, Grace? And the answer is oral medications. Oral medications is a non-invasive medical treatment for coronary artery disease. Nitroglycerin is the most common vasodilator used for acute cases of angina. It works to dilate or widen the coronary arteries, increasing blood flow to the heart muscle and to relax the veins, lessening the amount of blood that returns to the heart from the body. This combination of effects decreases the amount of work on the heart. That is physiological adaptation. Third largest section on the NCLEX at what? At what, ladies and gentlemen? I've said it a million times. 11 to 17%. Nope, we're not going back. You already know the deal. Hey, once we get past it, we don't go back. We don't go back, Cass. You already know. We don't go back. So going forward, here we go. Question number 25. Prolonged occlusion of the right coronary artery produces an infarction in which of the following areas of the heart? Okay, is it anterior, apical, inferior, or lateral? What are we thinking? What are we thinking? Hey, just like NCLEX, once you answer the question, you can't go back. Can't go back. Hey, look, don't make that face at me. Don't make that face at me. I'm just keeping it a stack. I think that's what the kids say. They keep it a stack. They keep it 100. It's lit. For real. You doing too much, bruh. Hey, you know what? Fuck these kids. Hey, I appreciate everybody's here. Make sure y'all smash that like button. Give me 40,000 likes. Why? Because I'm cool and I'm funny sometimes. You know what I'm saying? Make it happen. You know what I'm saying? Hey, if you're new here, I also want to know who you are, where you're from, where you're at in your nursing journey. Shout out to the Philippines. And please continue. Katrina, hey, I don't know what the lag is, but you better hold on. All right. Here we go. Here's our answer in 3, 2. And the answer is C. It is inferior. The right coronary artery supplies the right ventricle or the inferior portion of the heart. Therefore, prolonged occlusion could produce an infarction in that area. That is part of what? Physiological adaptation, which is what, ladies and gentlemen? 11 to what? 17% on the NCLEX exam. All right, Houston, Texas. I start my residency program in January. Lord willing. Oh, the Lord ain't willing. It's going to happen. You know what I'm saying? It's going to happen. All right. So trust and believe me, it's going to be a good time for you. Hey, you're going to get humbled. Hey, but be a sponge. Hey, we're doing NCLEX questions. Okay. Participate. I'm kind of funny. You know, sometimes, right? Share, follow, give me all them likes. Hey, we need 40,000 likes, y'all. Shout out to NY. All right. Don't be selfish your whole life. Give them to me. All right. Hey, you guys are getting free content, free knowledge, you know, all this love, all this teaching. I love y'all. I appreciate y'all being here. Don't troll my chat. I'm going to ban that ass if you do. Trust and believe me. Don't rush me either, y'all. There's a lag. You know what I'm saying? There's a lag. So you guys got to work with me with that. Okay. Nurseslabs.com, where I got these questions from. 7-day NCLEX course and private tutoring. Check those links out in my bio. And I'm going to do an Ask Me Anything after this. Okay. Question number 26. Which of the following is the most common symptom of myocardial infarction? Is it chest pain, dyspnea, edema, or palpitations? It's already 8 a.m. in the Philippines. Damn. So you guys are already at tomorrow. So you guys are like in the future. So what's the stocks look like for tomorrow? So I can get in on that. Oh man, I appreciate you guys being here. Hey, y'all are cool. This is a lot better than what I had on Tuesday, because it was like crickets up in here. I'm like, I guess nobody wants to learn on Tuesday. My professor is amazing. You talking about me? Are you talking about me, Cass? Am I your professor? Shout out to my surgical assistant. I see you out there. Hey, another little thing about me. I worked as a surgical tech for 13 years in the Navy. And like I said, I deployed as a surgical tech as well. Did life, limb, eyesight, emergency surgeries. Got to fly in helicopters, doing medevacs and casevacs. So, that's cool. So no, because you didn't go back. Fine, Cass, whatever. Anyways, the answer is chest pain. The most common symptom of an MI is chest pain resulting from the deprivation of oxygen to the heart. The classic manifestation of ischemia is usually described as heavy chest pressure or squeezing, a burning feeling, or difficulty in breathing. The discomfort or pain often radiates to the left shoulder, neck, or arm. Chest pain may be atypical in a few cases. It builds in intensity over a period of a few minutes. That is physiological adaptation, which is what, ladies and gentlemen? Where that bot at? Oh, I see you, girl. You poor. Well, that's too fucking bad, because I'm poor too. Called inflation. They should have put Black Friday fucking deals on groceries. All right, here we go. Physiological adaptation. 11 to 7. That's right. 11 to 17% on the NCLEX, ladies and gentlemen. The third largest section on the NCLEX. All right. Here we go. Is the NCLEX for America only? So the NCLEX, or the NCLEX, is both for the United States and Canada. Now, there are different types of nursing exams that they take, I know, in Africa and in the Philippines. But in order for you to work in the United States, you have to do the NCLEX here for the United States and Canada. All right, here we go. Which of the following landmarks is the correct one for obtaining an apical pulse? Usually with this question, you would actually see a diagram and you would like point and click type deal. Right. But now it's all written out for you. So is the left intercostal space mid axillary line? Is it the left fifth intercostal space mid clavicular line? Left second intercostal space mid clavicular line? Or the left seventh intercostal space mid clavicular line? What are we looking at? What are we thinking? Gabriella says, what'd you say? You said fifth space. Okay, Gabriella, I see you out there. I see y'all out there. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com. Free sets of questions. Also, 40,000 likes, y'all. 40,000 likes. 40,000 likes. Let's get there. And you guys already know what's going to happen after that, right? 40,000 likes. Make sure you guys share. Make sure you guys follow. If you guys are in nursing school, share it to your cohort. Share it to your cohort. Don't be greedy. Put them on like I'm putting y'all on. You know what I'm saying? Who added 7? Look, I don't know. I don't know. They wild out here with the questions. These ain't my questions, but they wild out here with the questions. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, kind of under the book. What you mean? And so it is the left fifth intercostal space mid-clavicular line, the correct landmark for obtaining an apical pulse in the left intercostal space in the mid-clavicular line. This is the point of maximum impulse and the location of the left ventricular apex, right? Physiological adaptation, which is what? 11 to what? That's right, 17% on the NCLEX, which is what? The third largest section on the NCLEX, right? Third largest section on the NCLEX. There you go. Y'all already know what the deal is. It's like I'm training y'all to know how to be prepared based off of the numbers and the amount of question that they would give you. You know what I'm saying? So here we go. Question number 28. Which of the following systems is the most likely origin of pain the client describes as knife-like chest pain that increases in intensity with inspiration? Cardiac, gastrointestinal, musculoskeletal, or pulmonary? What are we thinking? What are we thinking? Shout out to y'all smashing that like button, sharing and following. If you guys are new here, we're doing NCLEX questions. Got these questions off nurseslabs.com. Hey, I'm going to do an Ask Me Anything after this. So if you guys got questions about, NCLEX, you got questions about nursing school, how to get into nursing school, residency programs, all that good stuff, I will answer them to the best of my abilities. And I'm not perfect. I don't know all the fucking answers. And I will tell you that straight up. And, if you got a problem with that, then, go on the internet and complain. However, I will answer them to the best of my abilities. Why? Because y'all are worth it. Y'all are worth it. Trust and believe me, child. All right, here we go. Here we go, y'all. Here's our answer. Here is our answer. And it's always cardiac. Okay, Ann, I see you out there. Smarty pants. Here we go in 3, 2, and the answer is D. Pulmonary. Pulmonary pain is generally described by these symptoms. Pain may originate from several different structures within the chest, including skin, ribs, intercostal muscles, pleura, esophagus, heart, aorta, diaphragm, or thoracic vertebrae. The pain may be transmitted by intercostal, sympathetic, the vagus, and the phrenic nerves. The innervation of the deep structures of the thorax follow common paths to the central nervous system, making it difficult to localize the source of pain. Once again, physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. I like to call it being part of the big three. All right. Being part of the big three. Remember the big three: management of care, pharmacology, physiological adaptation. Okay, Kevin, I came back to say I passed my. That's what I'm talking about, T. Hey, right now. Hey, I need everybody right now. Stop what you're doing. And I need for y'all to give T her love, her flowers, all that good jazz. Tell her how you're proud of her, how you love her. Congratulations. Welcome to the greatest shit show on earth, known as nursing. If you have one piece of advice to give everyone that is on the journey to getting through NCLEX, or getting through their licensing exam, what would it be? Ma'am, congratulations. You get nothing but love from me. I'll give you all your flowers. Welcome to the greatest shit show on earth. I should put that on a shirt. If I put that on a shirt, would y'all buy it? Like, no lie. Oh my God. All right, y'all, here we go. Prepare for the smells. Hey, you already know what the deal is, all right? Oh man, I didn't even read the question. A murmur is heard at the second left intercostal space along the left sternal border. Which valve area is that? Is it aortic, mitral, pulmonic, or tricuspid? I got some people screaming at me. C, D. I saw a B on there. All right, y'all. Here we go. Here's our answer in 3, 2, and the answer is C, pulmonic. Abnormalities of the pulmonic valve are, auscultated at the second left intercostal space among the left sternal border. Murmurs of the cardiac system develop due to alterations in blood flow or mechanical operation. Murmurs develop from a multitude of mechanisms. Typical cases include low blood viscosity from anemia, septal defects, failure of the ductus arteriosus to close in newborns, excessive hydrostatic pressure of cardiac valves causing valve failure, hypertrophic obstructive cardiomyopathy, and valvular specific pathologies. That is also part of physiological adaptation, which is, of course, the third largest section on the NCLEX at 11 to 17%. Listen now, if NCLEX was like this, run me my license. Hey, you already know. You already know the deal. Hey, I'll run you your license. You know what I'm saying? You just, make it happen. So, and that's another thing. Think about the level of questions that these are, okay? you think about the level of questions that these are, you might want to start thinking. You might want to start thinking, because we remember, it's not about memorization. It's not about remembering. It's about analyzing and applying critical thinking to make a clinical judgment. Okay, here we go. Question 30. Which of the following blood tests is most indicative of cardiac damage? All right. Is it the lactate dihydrogenase? Dihydrogenase. There you go. Complete blood count, the the troponin one, or the creatinine kinase. What are we thinking? Elevated. Okay. All right. Tropin. Okay. All right. I see it. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I saw somebody ask if we could do case studies. So I'm figuring out a way to do case studies because they're so big and they're so in depth and they take a little bit of time. The biggest thing that I've noticed on here is that people are so impatient as I'm trying to explain. So I'm working on getting some case studies, right? But here's one thing, 7-day NCLEX course. I go over case studies in there, right? We talk about those as well. But I am working on getting some case studies in here just so we can make some stuff happen. Also, I'm going to be doing some other stuff offline, off of TikTok, where we will be going over case studies, talking about NCLEX and those other important things that you need to know, right? It's from nurseslabs.com. Yes, it is. All right, y'all, here we go. Here's our answer. Here is our answer. In 3, would definitely join that Zoom. That's what I'm talking about. Hey, if I did a Zoom meeting or a Zoom call or anything like that, would anybody be interested? Hey, if you are interested, start smashing that like button. That's going to tell me that you heard what I said. Okay, here we go. In 3, 2. Yes, do Zoom. I got y'all. We're gonna make some stuff happen. All right, and you're right. It is the troponin 1. Troponin 1 levels rise rapidly and are detectable within 1 hour of myocardial injury. Troponin 1 levels aren't detectable in people without cardiac injury. The troponin complex consists of 3 subunits: troponin C, troponin I, and I keep saying troponin 1, troponin I, troponin, and troponin T, and is located in the myofibrillar thin filament of striate muscle. The cardiac isoform tropin T and I are only expressed in cardiac muscles. Hence, troponin T and I are more specific than creatinine kinase values for myocardial injury, and because of their high sensitivity, they may even be elevated to the KC concentrations are not, which is the reduction of risk potential, right? 9 to 15% on the NCLEX. What Ann says, what did Ann say? Ann, what did you say? You said, it says, pray for me, guys. I have to take my boards next year. You're good. You got a whole year. You got a whole year to get knowledge in. It's called putting in the work. And ma'am, you got this. Don't even sweat that. You're good. All right. Any recommendations for schools? There's tons of schools out there. I would look at Western Governors University or Capella, those online schools that really do help out. All right. Here we go. But ladies and gentlemen, that is a wrap. You take your boards on Saturday. Morgan, you good. As a matter of fact, don't you come to my live tomorrow. UIW, it don't even matter. Why would I go to UIW where they charge $250,000 a year? That's wild. And guess what? Nursing education is still the same. You and I both know it. All right. Hey, that's a wrap, ladies and gentlemen. Thank you guys for hanging out. Hey, I'm about to do an Ask Me Anything. All right. I'm going to do an Ask Me Anything. All right. You guys hang out, ask me some questions. I'll hang out for a little bit, probably like another 30 minutes. I appreciate all the love, all the likes. You guys smashing that like button. I did have to ban some people, but it was only bots because they're dumb. Nurseslabs.com is where I got the questions from. You guys go over there and check that out for yourself. Also, at the 7-day NCLEX course, I'm going to show you guys what it looks like. Okay? As well as you guys can go check the link out in my bio on my website. You got a free download. We talk about test taking strategies, okay? But I'll show you guys what it looks like. Can you continue your story on why work at a level 1 trauma facility? Is it Mariana? I got you. All right, hey, so real quick, I'm going to show you guys what this website right here, what that website looks like. So you guys will come over here. This is what it looks like, y'all. Once you go over there, right? You just scroll down, check it out. That link is in my bio, and you can scroll down, read everything that you want to read about the website, and it says enroll in the 7-day NCLEX course. Hey, for $97, you guys get freaking, you get an on-demand review, which is currently not in there, but I'm working on that. You get lifetime access for $97. There's going to be over 100 content videos in there. The new generation NCLEX review is in there, which is like broken up into 8 videos, which is almost 4 hours worth of content. It is both for RNs and LPNs, and you get monthly content. Also, I got a Facebook group, y'all, that once you join that, you're a part of, okay? And then you guys can check that out. And then this is what it looks like inside. I'm going to show you guys right now once I get this big enough. All right. So, hey, right over here, got all this stuff, right? all this stuff. Look, check out the new generation NCLEX right here. You guys can see that. Let me bring this down some because they look kind of dumb. All right, here we go. So look, going over NCLEX questions, right? Talking about different ones. And also there are also case studies in here. And I know some people, like I said, you guys want to do case studies. We can do case studies, right? I got to work on that though, because like I said, most people are impatient, but we go through case studies, right? We go through case studies inside of the 7-day NCLEX course, and I explain them. I read them. We talk about like, hey, what are the most important things that you need to know, what to look out for? This is why content is so important, ladies and gentlemen. All right. And they have 6 different items or questions that you get asked with regards to that, right? The freaking, what do they, select all the apply? Remember, select all the apply, they're based off of their partial credit now, right? And then we have the close or the drop down, where it's essentially like the fill in the blanks, anticipated versus non-anticipated, all that good jazz, all right? And then also, look at all this content, y'all. Like in my pharmacology section alone, there are 18 videos. How to study pharm, doses calculation, anti-infectives, antibiotics, antivirals. And listen, this is what you get now. There's 55 videos in there. 55, and there's going to be well over 100 videos that are going to be in there. Okay, so you guys can go over to the link in my bio. Check that out. 7-day NCLEX course. That is for 97 books. I'm going to turn this camera around so that way y'all can see what we talking about. Hey, how y'all doing? Can you join the Navy as a nurse if you have ADHD? Probably. I don't see why not. It shouldn't stop you from doing anything. What's the difference with the previous one, though? What's the difference with the previous what, Ann? I didn't see what you said. What's with the new generation NCLEX? Okay, Ann, I'm glad that you asked. So the biggest thing about the new generation NCLEX is how they deliver the questions to you. The content hasn't really changed, but most definitely what has happened is how they deliver it. So 60 to 70% of your test is still going to be select all that apply, and it's going to be multiple choice questions. Like that is how they do that. Now, the difference is they've added like matrix grids, like the bow ties, or they've added the case study where they give you all the information. Like you have the lab ranges that are in there. So like if we're talking about potassium's 3.5 to 5.0, it'll literally say, hey, potassium normal levels, it'll be this. However, you need to know what is going to be displayed if I have a high potassium or a low potassium, and then what you need to do. Then what else do they have in there? They have extended multiple choice. They have, of course, select all that apply. That's in there. What else do they have in there? I'm just going off the top of my head, but they have so many other anticipated versus not anticipated, right? So like if the doctor writes a prescription for somebody who has COPD, what prescription would I anticipate that the doctor would fill out? That I would have to fulfill. Like, do I give them antibiotics, corticosteroids? Do we do IV fluids, oxygen? Do we do a cough suppressant? Like, so I need to know, I anticipate that order going in versus I don't anticipate this order going in versus like, that's not a part of the treatment plan or the care plan for that patient. Okay. You need to be able to interpret the labs. Exactly. So the labs are going to be there. Like they're going to be there. They're going to have the normal, they're going to have the lab. They're going to have the lab value. Then they're going to tell you what the normal lab value ranges are, but you need to know what it looks like if they're outside of those. I want to take the NCLEX soon, but I'm not sure what state I'll be choosing in the recommendations. Doesn't matter. And it doesn't matter what state that you take the NCLEX in. Like I live in Texas. If I wanted to go to New York to take the NCLEX, I could, because it's a national exam. Do you have a hard copy on Amazon? A hard copy of what? I don't know what you mean. Is it Joanne? A hard copy of what? So yeah, it doesn't matter what state and that you take your exam in. However, based off of the state that you do pick will depend on if, and I do say if because there's always a possibility. There is choosing a state that will allow you to take the exam like unlimited times. Like I know like Ohio's one of them. I think New York is another one. Places like Florida, you only get like 3 times to take the exam, stuff like that. Didn't realize you was a military nurse. Is it Claudio? Claudio, I am not a military nurse. I actually am a surgical tech in the military. I am a civilian nurse. So I don't have military nursing credentials. However, I've worked with military nurses my entire 16-year career. I've applied for nursing packages, direct commission packages. So I know all the things that you need to do to get there. It's just that I'm not one. Kentucky only 3 times a year. Here in the Philippines, before you take the NCLEX, you need to choose what state you want to work for. So you don't work for a state. You mean you don't necessarily work for a state. Essentially what they're saying is that they want you to pick a state that you have a license in. My suggestion is you look up what is called the Nurses Licensure Compact. And that is essentially where there's an act where all of these states, it's like a reciprocity act. It's like all of them agree with one another. So like if you decide to become, let's say you live in Florida and they're part of the NLC, and you want to go work in Georgia or South Carolina, you don't have, like, if you want to do it as a travel nurse, you don't have to change your license versus like if you went to California or Oregon or like Minnesota or like, I think Massachusetts that are not a part of the Licensure Compact Act, you would actually have to apply for another nursing license through those states. So that's what I would tell you. How many times to take in California? I don't know. You have to actually go to the Board of Nursing and look. In Florida, you can only take it 3 times a year. Yeah, that's what I thought. Sorry, I saw a video thinking it was you. Okay, cool. Oh, I get it. Nice. Yeah, for sure. That's exactly. Yeah, California is not compact. Yes, it is not. Hard copy of NCLEX on Amazon. Can we find it? You talking about like for my stuff? You can find, there's books for NCLEX all the time. On NCLEX, or are you asking me like a suggestion? The only one I could really just suggest that everybody talks about is the Saunders book. However, my course is an online on-demand e-course that you can find at my link in my bio. It says, thank you so much for taking time to explain these to us. Yeah, I enjoy doing this. This is what I like to do. I've been an instructor and an educator and a master instructor in the Navy since 2015. So almost 8 years, January of 2015. So almost 8 years. No, actually it's been over 8 years, almost 9 years. Obviously I don't know how to do math right? So, but yeah, so I enjoy doing this. So I've actually applied to work like as an instructor, like at schools, but I haven't gotten any calls back and they need instructors. So I just took it into my own hands and I just started teaching here on TikTok. What are your first job? What was my first job as a nurse? So my first job, essentially working as a nurse, was at a burn center. I was still active duty and I was still getting paid to be on active duty, but I got to work inside of a burn center. So I worked in a burn ICU for the first 6 months. And then I moved from there. I went to a medical ICU and I floated to a neuro ICU. So that was my first nursing job experience, was the burn ICU. It was ICU. And then after that, I went to the recovery room, or PACU, post anesthesia care unit, and then I went to the operating room as a circulating / scrub nurse because I have the skills as a surge tech. So I was like, you know what, let me just go back in there and just get used to being back where I was. New compact nursing says that if I move to a new state, you have to what? What, Barbara? What? How is it to be a nurse in Texas? Are taxes high there? So Texas doesn't have like state taxes. So it's not like California. It's not like Oregon. It's not like Washington. It's not like New York, not like Massachusetts. So you should really be on TV or film. Do TikTokers get discovered by Hollywood at all? Okay, Jen, I don't know. I don't know if I should do that or do film or whatever. I actually thought about doing voice acting. I've been wanting to do voice acting for a while, but one thing at a time. Can you explain why we should work at a level 1 trauma? There we go. All right, Mariana, I got you. So the reason why you should work at a level 1 trauma facility, I did explain that already, but level 1 trauma facilities are community hospitals. They get federal funding, they get state funding, they get all the money, right? Versus like if you go to a private hospital, like, some of these other private hospitals, they are privately funded. They do get some funding like from states and government, depending on what's going on. But level 1 trauma facilities get everything, right? Because they're funded, they're by the city, by the state, by whoever. And you get, it's a teaching hospital, right? They have residents. They have they have residents teaching everything. Like the biggest thing is that you always want to feel like you always have the most help. And I went to a hospital that was not a level 1 because I was chasing the money at the beginning. In hindsight's 2020, if I could go back and do it all over again, I would have went to a level 1 trauma facility, but I didn't, because the level 3s or whatever, they're not for teaching. They're to put you to work. You're there to go to work, not to learn. And I'm not saying that you don't learn anything there, but based off of my experience, that's what it's for. How many times do you host these sessions? I do these sessions three times a week, Monday, Wednesday, and Friday. But last week and this week, I was trying to do it every day to see how it was, but I didn't get really good traction over the last 2 days. So I may just go back to 3 times a week. But I'm also going to start doing some Zoom stuff. If I'm just like, hey, come check me out for $1, and we'll go over some stuff more in depth. And then you guys can get your questions answered more in depth as well. Apply within 60 days. Yes, Barbara, that is very true. That actually came out within the last month, that if you move there as a resident and as your primary license, yes, within 60 days of you moving there, you have to apply for that state's board or that state's license, 100%. Interesting. Sky College in Bowling Green is hiring. Why would I ever want to go to Kentucky? Why would I do that? No, absolutely not. What course would you teach if you were in school? If I was to teach when I was in school, I would work in the lab. I would most definitely be an adjunct instructor out at the hospital because I'm a very hands-on person. But if I honestly would probably teach med-surg. I did like Claudio. I did like the PACU. PACU is actually like the holy grail in my opinion. Do you have to retake the NCLEX to get a license in a state that aren't part of the no? So Lori, that's a good question. So if you got your license in California, which is not part of the compact, you essentially, if you wanted to work in Texas, you would essentially have to apply for Texas Board of Nursing. Once you apply, they're going to do their background check. They're going to make sure you're legit. They're going to go to California and be like, hey, bro, is she legit? They're going to be like, yep. And then all you pay the fees and all this stuff. And then boom, you get a license. That's how it goes. There is ATI testing prep instructor online available. True, but I teach like this all the time, so I really don't even need to do all that. Nursing like kind of in 39 states, federal employment. You can work any state. Yeah. So if you're a federal employee, so like let's say if you work for the VA or if you're a military nurse, you can go and you can work anywhere. However, the stipulations are that you work in those hospitals last time I checked. So if I have a license in Texas and then I end up going to California, but I work at the VA in California, which is a federal building and a federal employment, that's different versus if I went to go work at a civilian hospital, not so much. It says goodbye. I have to eat breakfast. All right. And hey, I hope whatever you're eating, it better not be like balut or nothing like that. You better be not eating that. I know it's a delicacy. I have many friends that are from the Philippines that tried to get me to eat it. Disgusting. Hey, to each their own, man. It says, do what in your house? I don't even know what we were talking about. I hope I get to work in the U.S. Hey, Ann, if you're still here, I'm gonna tell you something right now. There's like 16 things I got to get to, but Ann, I'm telling you right now, don't you ever tell me that you're gonna hope to do anything ever again. I need for you to tell me what you will do. Solidify it. Put it in, speak it into existence, and it shall be so. All right. I hope I get to work. And like, no, I'm going to work in the U.S. one day, or I'm going to work in the U.S. Not even one day. I will work in the U.S. That's what you will say. I don't like the ATI test prep like the board vitals. I don't like board vitals at all. Board vitals is trash. Like Grey's Anatomy. What about Grey's Anatomy? Teaching hospitals are the best. Yes. Like Grey's Anatomy. Got you. Sounds like long-term care could be. Which unit did you like working in best? Honestly, I liked working best in the PACU. For LVN students also, like for the course, absolutely. Are the lessons in the U.S. are fast-paced too? What do you mean by lessons, Ann? Hospital versus nursing home as a nurse? That depends on you. That depends on you, honestly. Some people like the long-term care facility aspect of nursing. Other people like working in a hospital. That just depends on you. I personally, if it was me, I would rather work in a hospital setting. That's just, if I had to choose between the two, that's me. Kentucky is awesome. I didn't say Kentucky wasn't awesome. I'm just saying I'm not going to Kentucky to go work in Bowling Green. Why would I do that? Is PACU pre-op and post-op? No, PACU is post-op. PACU stands for post-anesthesia. After anesthesia, so after surgery or after a procedure, care unit, okay? Some places they'll have pre-op and post-op in the same area, but it'll be like pre-op over here, you'll roll to the OR. Once you get for the OR, you'll go to the post-op, and then the pre-op is on the other side of the wall, so something like that. I passed in March, but haven't made the move for lab yet. Well, you got to make the move. How about if I pass in NY, can I work in Texas? Katrina, absolutely. You sure can. Pass, get your nursing license in New York. Bring your ass, apply to work in Texas. Once they give you the fucking thumbs up, you'll get a Texas license. Do you think it's worth it to be a nurse? Lindsay, that depends on you and solely what you want to do. If you want to be a nurse, so a lot of people are saying that, being a nurse is a calling. And if you feel like that's it for you, that's cool. However, honestly, nursing is just like every other profession. You got to really want to do it. And it's a job. You know what I'm saying? It is a job, bar none. So what I'll tell you is, it all just depends on you. But nursing, once you get a license, I'm telling you, it could spread like wildfire for the things that you could do. PACU is a mini ICU. Yes, it is. So you definitely got to be, you definitely in the PACU will get intubated patients. You will definitely get them on drips. You will definitely get them intubated. Did I already say intubated? Yeah. They definitely are number one respiratory compromise, all that stuff. So you definitely have got to pay attention to that. That's why when I went to the PACU, I was just like, oh yeah, this is easy. I only got one thing I got to worry about versus 8 drips. And then they're coming off of the freaking vents. And oh, it was great. I loved it. I have lab tech certification from Nepal. Okay. But I have 8-year gap. How I get a job in Canada. I don't know. I don't live in Canada. I don't know exactly how that would work. But if you have a lab certification and if it's still valid, you would essentially have to find out what the lab, organization that governs it. You would have to see if they take your lab cert from Nepal. Lori says, I'm not a nurse, but it's always been my dream and I'm 48. Hey, how about we stop making it a dream and we make it a reality? The only way that you can make it a reality is putting those actionable steps in place to get there. So how about we not make it a dream and turn it into a reality? That's just me. Hey, I don't coddle. I'll tell you like it is. Hey, if you guys are finding value, make sure you guys smash that like button, okay? How about if I pass the NCLEX in New York, can I still work in Texas? Katrina, I think I already answered your question. Nurse Kev, Anita, do you recommend repeat test takers to take at the same location or a brand new location? Doesn't matter. Doesn't matter. Every single time I failed my NCLEX, I took it at the same location. So I went to the same testing center 4 times. It actually kind of helped me out for the simple fact that by the time I got there, I already knew, I was already familiar. I was already familiar about what the testing center looked like. My first patient in ICU died and I was traumatized with that. I am on the Code Blue team. And let me tell you something right now. I worked during the second wave of COVID in the burn, the medical, and the neuro ICU. And let me tell you, first 15 minutes I walked into an ICU, there was a 39-year-old post-op labor and delivery patient, gave birth to her daughter, had massively bad postpartum depression because she had COVID. They took the baby away from her. She didn't get to see the baby at all. And she coded because of COVID because she had, all the fluid in her lungs and had clots that were going to her lungs. She had a PE and she died. And that was within the first 15 minutes. And I was just like, oh, so this is what's happening here. The girl that was there, that was with me, in that first day, she cried within 15 minutes and she couldn't do it. And that's okay if you can't do that. That's okay if that's not for you. The greatest thing about working as a nurse is that you don't have to work bedside. Being an RN or an LPN or whatever the fuck you want to call them or whatever you are does not mean you have to work bedside. Okay. Whereas pre-op is within the perioperative spaces. So it's periop or perioperative spaces. So it's like the pre-op, surgery, or the OR and PACU, like those 3, right? Or the cath lab is over there, so on and so forth. What state are you in? I live in Texas. Can you recommend the best resource to study for the NCLEX and how long you should study for? Well, I have a course. I have an NCLEX course. It's for $97. You get it for a lifetime, and that link is in my bio. You can check that out. That's the one I would always recommend because it helps people and it has helped people. So, and how long you study. Usually people say you can study about a good 3 to 4 hours a day, but there's a lot more that is into it besides just how long you should study. How effectively are you studying? What are you actually studying? Like, what is your deficit? Like, what is the worst area that you need need the most help on? So one thing I'll tell you is think about the area that you need to start with, and then you need to dedicate at least a couple of hours in order for you to do it. And then when you start doing questions, you need to be able to build endurance for that. Okay. Do you know any MP first assist in the OR? Yes, Alexis, I do. I actually had one that worked in ortho. She was actually a OR nurse. Then she was an RN FA, and then she went to nurse practitioner school. And so now she's a surgical nurse practitioner, and she works in ortho. And she does that for sure. I perform CPR patient while trying not to cry. Hey, being a nurse is hard if you're a crybaby. Hey, there's nothing wrong with that. There was a guy that we coded and we intubated who had been on our floor for a couple of weeks. And he had this thing where he played music all the time and he started to code. And somebody was just like, hey, turn his music down. And the doctor was like, no, keep it up. And then the moment that he said that, everybody in there started bawling while we were coding him. It's wild. What path would you recommend to get into to PACU? They have residency programs for PACU. Or you can actually just find openings for those jobs and you can apply for them. Coco says, I'm so sorry. What's the difference between PACU and ICU? So the PACU is post-anesthesia care unit, which is coming from the operating room or from somewhere with a procedure. And the intensive care unit is where, you have the massively sick patients that require their acuity is they have a lot going on. It's where, that's managing nursing, like at its core with that patient. All right. It says, you're awesome. I'm an LPN and I'm going back in a year for RN. This helps. I'm glad this helps. Hey, I'm just letting you know, if you're going to go back for RN, go get you that course. Go check it out. And it's going to be there for a lifetime. All right. Any tips for ATI exam? What ATI exam? Thoughts on going for nursing as a second career in your 30s? Amanda, I'm glad you said that. My first career was in the military as a surgical tech. I did that from 2000, and I joined the Navy in 2007, and I became a nurse in 2020. So this is my second career. You most definitely can do it. My thoughts are, if that's where you want to go, do it. But you got to be very aware. You've been in the corporate structure doing other stuff. When you come here, it's like moving to a new state, not knowing nobody, you got to understand how the machine works. You know what I mean? So be prepared for that. Cardiac tech here in MSN program now, advanced farm K. I bet. So advanced farm, honestly, YouTube. And advanced farm, if you're in an MSN program, definitely YouTube. I like ICU Advantage. He goes over a lot of medications, and Farm D, they're really, really good. For real, I have a 50-something-year-old, and we love her. Hey, I had people that were in their 50s that were in my class as well. What other options are there for nurses apart from working in a hospital? Clinics, insurance companies, pharmaceutical companies, medical devices companies. You can do nursepreneurship, start your own business. Like, there's so many things you could do. Do you still have the NCLEX info available, like the material on your site? Is it Lovin? Yeah, you can go to the link in my bio, and it'll show you everything that comes with inside. Like, it'll tell you, it has the curriculum on the website. And and the thing about it is that curriculum is going to be uploaded and updated, right? So if it's not there, at least you get it for $97, and I start uploading stuff in there. Or recommend any study for LPN. I'm ready to pass. Hey, if you're ready to pass, get out there. Hey, get out there and make it happen. All right. Also, another good one, like for their question. I mean, they have all types of ones out there. They have Archer, they have UWorld, they have Kaplan, they have Hearst. There's so many other ones that are out there for you that you could use. Choose the one that's different. I did that strategy on the. Oh, you must be talking about like for different. I guess it's different testing sites. I didn't change it. I went to the same one because it didn't distract me at all. I was more comfortable being in there because I knew what it looked like. So how do you work 2 bedside jobs at 2 different hospitals? How's scheduling with that? So that scheduling is all based off of you if you decide to be a PRN nurse. So that all just depends on you. You're one who's responsible for your schedule. Tips on saving soon to grad, and I don't want to be quick on splurging. Roth IRA, high yields. So Roth IRAs are good. I mean, you can look into real estate. You can look into bonds. You can, all kinds of stuff. There's different types. I'm not a big expert on that. So, Jessica says, what's the pass rate for the 7-day course? So my course was it's brand new. Started that course at the end of June. I have over 200 people that are in there right now. And every testimony that I've gotten back, which has been about 40 of them, they have passed. So, like I said, I'm coming up with a system right now to actually, hey, like I got people that pass, but it's kind of hard to gauge when I have a lot more people that are in there and they don't give testimonies. And some people don't give testimonies. And if you don't, I can't help that. I can't just like come over there and be like, hey, give me that testimony. Right. So I was like, hey, that's the testimony is the only way to help me grow as well as to make the program better for y'all. So, is there a question bank in the set? So Jessica, there is not a question bank inside of the course yet. However, there is tons of content that's in there right now. Can new grad nurses get in the PACU? Yes, they can. Alexis says, thank you. Performance surgery is the dream. Hey, stop telling me it's a dream. Make it a reality. I'm a surgical nurse and I'm dead inside. Panda, I believe it. Christy says, what course? My 7-day NCLEX course. That link is in my bio. I'm in the Navy now. Shit posting 101. What's your rate in the Navy? YouTube got me through school, no cap, and mnemonics and studying, of course. Yeah, hey, YouTube gets a lot of people through school. Trust and believe. Just like me, I am no different from that. Do you know anyone or have referred for cruise nurses? No, I've actually seen somebody. Hey, type in cruise nursing on TikTok and watch how many people come up. What was the YouTube for studying farm again? So you can look at like Farm D, or you can look Khan Academy is a good one, as well as ICU Advantage. I like him. I like that guy. How much time did you wait between each fail? Feeling discouraged right now, trying to study more. So the first time I failed in 2018. And then it was about 9 months before I took it again because I just didn't know how to do specific things. And then when I failed it the second time, it was 45 days. And then when I failed it the third time or the second time, yeah. So first 9 months because of my own ignorance. When I took it the second time I failed, I waited to 45 days. Took the third time, then I took the third time in September, and then I didn't take it again until June of the following year because I was feeling discouraged and it took like some mentorship for me to get back to where I wanted to go. So here's the one thing I'm gonna tell you. Feel discouraged all you want, but everything is your fault. I failed 3 times. And it was my fault because I was lazy. I didn't have accountability. I didn't do my time management. I didn't study effectively. I didn't honestly reach out to people that I knew, like, hey, can you point me in the right direction? Or, hey, taking that initiative to make some stuff work. You know what I'm saying? Like, so you got to put in the work. Everything is your fault. I'm sorry. No, I'm not sorry to say that because everything is your fault. But one thing I will say is how are you going to fix it? And then let's say some things are out of your control. And how are you going to fix it? That is listen, when I coach people one-on-one, I don't know if anybody saw my story today, but I had a young lady that I coached for her LPN and she passed on her first time with 30 days of working with me. That's what my coaching is, the NCLEX one-on-one tutoring. Like I told her, I was like, if you are getting low grades, it's your fault. She got about 6 or 7 quizzes in and I was just like, what are you doing? And then she's like, I was like, well, I'm telling you right now. I was like, you have the same amount of time that I do in a day. We have to fix and we have to allocate your time. You need to do it. And then what happened? I mean, like fucking clockwork. She started scoring really high on her exams. I mean, it said LPN, LPN, LPN. That's what I say when I'm coaching you, right? LPN, 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 LPN. RN, RN, RN. If you're above a certain level on your quizzes, I'm going to be like RN, RN, RN. I don't care what you think about the number. I'm going to be like RN, RN. We're going to tweak and peak as we go. So like I said, you have to be responsible for what you are not doing as well as what you are doing. That's called accountability. Okay. Don't be afraid of that exam. The exam's going to be there whether you like it or not. So now you have to change up your thought process and how you approach it. Okay. Lovin says, okay, so I don't feel bad. It to be the discouragement for me. And I'm sure if you, so Lovin, yeah, everybody gets discouraged. Everybody gets discouraged. But the one thing I will not allow to happen in front of me is for you to sit here and throw a pity party and say, oh, why, me. I'm going to be like, hey, respectfully, get the fuck up. Get up right now. Can we pay via PayPal? Yeah, so I have all those links, or you can pay via PayPal. You can do Stripe. It has all those things that are in there for you. How can I do management if working and studying at the same time? So, Katrina, I don't know what your life is like. This is what we call an audit. Sit down, get off your fucking phone, stop scrolling on TikTok, because I know that's probably what you do, because that's what everybody does. This isn't just directed at you, but I know that's what everybody does. All right? Get off the phone and audit yourself. Right? Literally, get an Excel spreadsheet like I did. 6 a.m., because that's what time I woke up, 6 a.m. to 6 a.m. the next day. And literally write down every single thing that you did hour by the hour. Hell, if you want to get even more regimented, do it every 30 minutes. And I bet you, I could be like, oh, let's trim that fat out. Oh, let's stop doing that. Oh, let's stop doing that. The moment that you're able to audit yourself, you will be so surprised on how much time you get back to yourself. You will be so surprised. All right. I started in January. I'm old and I'm terrified. Look, I'm tired of y'all coming up in here and telling me that y'all are old and terrified. Nobody cares that you're old. Nursing doesn't care that you're old. You telling me that you're old is an insecurity that you have. And one thing I will tell you is that I appreciate you being vulnerable like that, but use that vulnerability and turn it into a positive. Nobody cares how old you are. You want to know what, Sarah? You want to know what you bring? You bring life experiences into a program that's going to be the majority demographic of like 18 to 25. Did you ever think about that? Did you ever think that, hey, you might be the mama bear of your group, of your cohort? Don't think of it as being old. Think of it as being mature and bringing a certain aspect of life into a bunch of young women. 89% nursing, need I mind you, right? 89%. You bring in a wealth of knowledge that they haven't even experienced yet. Okay? So stop saying that you're old. And don't be terrified. Embrace it. It's going to happen. You want to know why nursing school is the way that it is? It's to keep people out. That's why. That's why all those things are in place. It's to keep you out. Yes, it definitely takes self-control and time management. I'm learning that. Absolutely. And not only do you learn it, you make it a way of life. That's how you do it. Is the NCLEX going to change partial credit soon? No, Brandon, it's going to it's like that for the foreseeable future. And I wish when I took NCLEX that the stuff that they have there now, I wish I had. I probably wouldn't have failed it as many times as I did. I'm a high school junior. Do you think I should do nursing or computer science? Lindsay, I don't know. What do you want to do? It's like you want me to give you permission to do something else. The question is, Lindsay Williams, the high school junior, what does Lindsay want to do? It says currently utilizing Archer. Any tips or recommendations? If you're utilizing Archer, I mean, I like Archer. When I coach people, when it comes to NCLEX style questions, because we break down questions together in my coaching. I'm just like, hey, what question are you having difficulty with? Or, hey, let's do a quiz together and let's break it down so you can see it in real time. That's the stuff that we talk about, right? But one thing I'll tell you about Archer is that you definitely, when you do your quizzes, number one, they need to be randomized. I don't care what nobody says. People are just like, oh, do them section by section. But your NCLEX isn't like that. Your NCLEX is random. So all of your quizzes need to be random. They all need to be maximized at 85 questions. And then you need to read and review your questions. Period. That's what you need to do. Old and fly. That's what I'm talking about. My daughter is joining me in nursing. This will help her. It will. Big facts. It says, yes, my aunt told me if it was easy, everyone would do it. Can you imagine if you saw imagine that person that was the class clown that you knew wouldn't amount to shit when you were in high school. And then they just applied and they just let them into nursing school. And you're like, without all of those checks and balances that are in front of it. And then they become a nurse. And then you're just like, bro, I saw this dude like throw himself off top of a van to make his friends laugh. And he out here taking care of people. Oh, no. Child. Absolutely not. I'm still in my prereqs and it's really difficult. How do I get help for that? Is it Janae? So one thing that you need to do with your prereqs is that you need to, number one, it depends on what prereq that you're in. So if you're in your science classes, definitely utilize YouTube. Khan Academy is a good one. They have tons of YouTube channels that are out there. Khan Academy is a really good one as well. Is this strictly for NCLEX or do you assist with T's and HESI too? What does it say? Entrance to RN or LPN? Coco, I don't. I get asked that question a lot. And I might actually just do that. But my bread and butter is NCLEX prep. That is my bread and butter, but I definitely give recommendations for entrance exams for books and stuff like that. Facts. I graduated in 6 months with my ADN. What source do you recommend? My school only does Elsevier. Oh, Brandon. So you must have HESI. Oh, I know all about that. Brandon, number one thing I'll tell you when it comes to studying, 7-day NCLEX course, $97, bro. You graduate in 6 months. When you graduate in 6 months, there's going to be another whole freaking review in there on top of a new generation NCLEX review on top of tons of content for you. So I would definitely go over there and check that out. A good spot to get questions, UWorld, Archer. Those are usually two I recommend, but I like Archer. I would always recommend Archer's QBank. Me, personally, I would. Can you point out your website where you can complete payment and try to buy, but I can't find? So I will show you right now. I will show you that right now. Give me one second. I'm going to turn this thing around. You guys hang out with me. All right. So this is the website, ladies and gentlemen, right here, right? So this is just a different link. It's the same one. So if you go to, let's see, it's the same one. So special. So the 7-day NCLEX course, right? Thebootnurse.com/special. It'll take you here. And then there's a link there's a button that's right here. A button. Enroll in the 7-day NCLEX course, right? And it'll take you right here where it says, hey, enroll in the program today for $97. All you got to do is click buy now. And then buy now, it'll take you to this website. It'll take you to this link right here. Once you do that, hey, all you got to do is put in your email, your name, and then it'll walk you through the prompts and all that good jazz. That easy. All right. And then once you are inside of this is where it takes you, right? This is what I have inside the course right now, right? Here's the welcome. And here's why I do this at the beginning, y'all. Listen, I tell you what the NCLEX is because some people don't understand or get it, right? And then I talk about what, taking the NCLEX, critical thinking, and then the rules, and then we jump right into the review. And then after the review, you get tons of content, right? Right now, there's 55 videos in there with us projected to have over 100. Honestly, there's probably going to be like 150. And I'm going to keep adding as well. And then, of course, here's our case study, right? That's inside of the review. This is, what question is this? This is, right? Let me go. Come on. So this was like question 18, right? And I go over 100 questions, by the way, y'all. I go over 100 questions. And like right now in my pharmacology section, there are 18 videos in there. 18 videos. All right. 18 videos. All right. So like I said, make sure you guys go over there and check those out. All right. Check those out for yourselves. Right. It says, did you create quizzes or just do the readiness exam? No. Oh, no. You, Noemi, ma'am, you create quizzes. You want to know, like, what would I look like just telling you, yeah, just go in there and do the readiness exam? You want to know what that does? That doesn't allow for you to utilize all of the questions that they have available, right? So you do random quizzes, 85. Nursing was my second degree for me. Same. I was older than my cohort. Same. Well, the majority of my cohort was young, but I was like in my early 30s. Well, I'm in my mid 30s now, but I was in my early 30s. But my first degree helps me. That's great. Aurora, that's great. Is this Archer? Am I saying it right? Is it Archer? Yeah, like Archer, like an Archer, or Archer the show. That's where they have really good questions at for sure. Those jazzy payments and complete is not opening, please, for me. Hold on. I don't know exactly. Let me see. I'm gonna check right here on the side of the website to see what you're talking about, because I don't know what the issue is. Have you heard any good news about going to the 3-day Mark Klimek review for NCLEX? So, Brandon, I actually went to Mark Klimek's review in 2019. I paid $300. It was $399 or $350 at that point, and that review is exactly like the audiobooks, or the audios that are floating around the internet. And I thought it was great. I mean, but honestly, if you don't need to, you don't have to. But I mean, it's still a good source. But that's another reason why I named the 7-day NCLEX course the way that it is because it's 7 days and it's self-paced. Because you want to know what happens in a 3-day review, any review. When I tell you, you get mentally exhausted, right? And I'm telling you, as somebody who's done Hearst, who's done Kaplan, and who's done Mark Klimek, right? It's so much. It was so much. And so I was just like, man, how would it be if like we just did it like for 2 or 3 hours, but we hit like the major things that we need to do, for the parts that you need to know. And I was just like, well, hell, why don't I just do that? Which is exactly where the 7-day NCLEX course comes from. So over the 7 days, you will get the concepts. You're still required to put in the work. Like I had somebody say, you told me in 7 days I was going to pass. I was just like, in 7 days, you will get the concept. I was just like, if you put in the work within 30 days, 100%. I've actually coached people within 2 weeks and they've passed. It all just depends on you. But I don't know what you're doing on the back end. I don't know how many times you've been studying all the other stuff. So it all just depends. But I like the review. I went to it. My exam will be December 13th, and I'm doing Archer. My scoring is high or very high. Will I pass? I don't know. Will you? Based off of those predictors, I would think so. Me, I was using UWorld, and I was using UWorld at one point, and I was getting high, predictably high, and all those, and high chances of passing, and I failed first time, and I was like, what the hell? Like I had the information, like what the hell? Second time, same exact thing. Third time, same exact thing, and then on the third time, I was like, I'm not using Archer anymore, and so then I ended up using Kaplan to help me pass, and I liked Kaplan's questions. So like I said, it's not just about the predictor exam. You got to think about your whole aspect of like you, right? There's a lot of things that were going on with me that also contributed to the fact that I didn't do well, right? Anyway, from time management to accountability of my ineffective ways of studying, like it just depends, right? So, but based off of that, if you want to go off that, yeah, you're going to rock deep. You're going to rock it. You're going to rock that test. All right. But this is just one guy's opinion, and then one guy's, that one guy's way on how he made it. Right. It says, I'm a U.S. Army veteran. Go to the Navy Reserves, now studying nursing. New York, I don't know what you mean. Like, are you telling me? Like, I don't know what you mean. Grace says, after your third failure, did you have to take a refresher course? I did not, Grace. I did not have to do that. Same like you. You from, yeah, I'm in the Navy. Yeah. I mean, oh, so you were in the Army and then you became a nurse and then went into the Navy Reserves. Is that what you said? No. Oh, okay. You were in the Army and then you went into the Navy and now you're studying nursing. Okay, got you. Tracking. Shout out to you. Shout out to you. Hey, so I caught up on all the questions. Hey, for all 77 of y'all, appreciate you guys rocking with me. If you guys are finding value or have found value, smash that like button and give me a follow. And make sure you guys share, because that is the trifecta of what TikTok wants. Is the NCLEX trick real? They say if you pass it, that it won't let you register. So Brandon, check this out. You can either go to my bio, and I actually have clips of where I did a video on YouTube, or you can go to YouTube where I did the Pearson VUE trick. Okay. And it has a 99% chance, blah, 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 of if you try to do the trick, it will not let you register for it again, or it'll take your money, right? However, I have actually coached people, and I have actually told people that it is not guaranteed, because all it is a glitch in Pearson VUE system, right? I've had people literally say, hey, I got the bad pop-up and I passed. And then everybody is just like, yo, this thing is 100%. No, the fuck it's not. Even in my video, I say this is not, it is the unofficial to the unofficial. You know what I mean? So you do it at your own risk. Me, when I passed on the last time, when I took it on the last time, I was not going to do it because I was already nervous. And then after about 12 hours, I stopped thinking about it and I didn't do it at all. Right. So definitely you can do it. I actually have a walkthrough on YouTube. The link is in my bio, but the YouTube is the Boot Nurse. However, I did it afterwards and I was like, okay, yeah, so it works. It's there, blah, 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 blah. But you can check it out and you can try it for yourself. Waiting to be approved to take the P in NCLEX. Is it, oh my God. I don't even know how to say your name. I'm going to mess it up. But hey, you're going to be ready for that NCLEX. Is it Libra September? Appreciate I appreciate what is that? A gift? What kind of gift is that? That's nice. Appreciate that. Did you take an exit exam for your school? Yes, I did. I took an exit HESI and it fucking sucked. I hated everything about it. For your third time, when you passed it, did you feel confident on the test? So when I took it, I took the exam 4 times and I failed it 3 times. When I took it on the 4th time, there was nothing but just positivity that was running through me. I mean, words of affirmation. I mean, if I could tell you all the negative things that I said to myself the past 3 times, but on the last time I was just like, I'm passing that exam. I was like, I am passing this NCLEX exam. When I went into it, I sat down and then I got into, usually when I would study, I would end up doing this number right here. And I start clicking and I was in the zone. Before I knew it, I was at 45 questions and I was probably about 50 minutes in or now about 50 minutes in or something like that. And then, no. I got to like question number 9 and I was like looked at my hand and I was like, shit, I'm in the zone. And I stayed that way. Didn't lose focus, didn't listen. I was in, right? And so as I sat there, I got to about 45 questions and I was just like, all right, let me check my time. And I was around 50 to 55 minutes. Once I did that, I was like, all right, cool. I hid the counter and I hid the time. Next thing you know, I just kept going. And then it looked like there was a lag because, hey, I just want to let y'all know there are chances that the computer can mess up. They can lose power, all that stuff. Be ready for that. And if it happens, may God just be blessed with you because you will be so pissed. And so I thought there was a glitch. I was like, man, why is this taking so long to go to the next question? And then it sent me to research questions. I'm like, that is the time where you can be nervous, where you want to go throw up, where you want to go, if you got the BGs, that's the time after you take your exam. And then when I left the exam, I went to my favorite spot and I ate like this nice deli sandwich. And then I was just like, oh yeah, I passed that exam. And then sure enough, 2 days later, I checked Pearson VUE. It was there. So, I walked in there feeling more confident because I was more prepared for it. Is it Santi? Santi is how you pronounce it. Okay, I got you. I heard you pay to get your results sooner. So Santi, on Pearson VUE, you can pay for your results to see them. It's like $7.95 or something along the lines of that. Or you can just go to your board of nursing and then put in your name, hit enter, and then if your license is there, that means you passed. If your license isn't, means you didn't pass, right? So that's how you do that. So hey, I appreciate everybody being here. Hey, if you guys are finding value, make sure you guys smash that like button. All right, and I know somebody was asking me specifically, telling me that a link wasn't working. So I'm going into the link tree. What in the world? Okay, so go into the link tree. Let's see what's in here. And we go to the 7-day NCLEX course. Yeah, so the link, so I don't know, who is it? Is it Joanne? Joanne, I think it was you. I'm not sure. That was trying to get in. Yeah, Joanne. So I don't know if something's not working, but I just checked it right now, and all that stuff, everything is working on my end. So I don't know what other type of issue that you have going on. Santi says, I'm so nervous. I want to pass before the new year. Santi, how about we change our verbiage? How about we say, I will pass. I will pass. All right. Don't be nervous about it. So here's the thing. Here's another thing I'll tell you. I'm going to give you perspective. There are a lot of things happening in the world right now. I'm not going to say names. I'm not going to say where. You guys already know, unless you're living under a rock, right? Give yourself perspective. You could be there. If the worst thing that could happen to you is that you not pass an exam, I think that's okay. Because you want to know what you could do? You could always restudy for that exam. That's the stuff that people don't ever talk about. They always drive this type of fear into you. My school was the exact same way. You want to get 75 questions. You don't want to take this exam again. You're right. I don't. But what if I do? Professor so-and-so who hasn't been bedside in 25 years. What if I do? Can we talk about that? No. Okay, fine. Fuck me then, right? So prepare for it. Prepare for it. Keep coming to these lives. Check out the stuff that I got going on. Come to these Ask Me Anythings. Surround yourself in a community of people that are going to support you. And you'll be Gucci. You'll be good to go out here. How would you know if you are prepared enough? So when you start taking your questions, the biggest way to gauge where you are is your quizzing and your practice test results. Okay. Have any tips for the exit HESI I take next semester? So what I'll tell you, the next HESI is going to essentially be an accumulation of everything. But biggest thing, management of care, pharmacology. Those are the management of care, transitions, pharmacology, delegation, assignment, prioritization. That's what it is. That's what it is. Nicole, what's up? Why you say my name like that? What'd I do? I appreciate the follow, Nicole. What is a positive abnormal pregnancy test mean? A positive abnormal pregnancy test? I don't know. I don't work in labor and delivery. Hey, that's another thing too. If anybody starts coming in here asking for medical advice at any point in time, no one in my chat will ever sit here and do that. Okay. I successfully got in, but she says 997. Is it correct? What? What are you looking at? What are you looking at? What's up, user 57? What are you looking at? Hold on one second. I'm going in right now and I'm looking because I don't know what you're looking at. Hold on one second. All right. Hey, if you guys are finding value, it's me again. Yeah, girl, I see you up in here. So the link is in so you went to special. All right. So now I got to troubleshoot this. So give me 1 second because I don't know what you're looking at. So your website, ma'am, I understand that. I'm looking at her right now. So hold on 1 second. So I'm looking at it right now and let me see because I just clicked on it and that is not where it took me. So give me 1 second. Let's see. By now. Let's see. So there's that. This is the crazy thing about doing, this whole entrepreneur guide stuff. So let's see. So the call to action. Yeah. So, all right. By now. I want it to go. Oh, okay. Hold on 1 second. Let me see. Because I don't know what happened to that. Give me 1 sec. All right. There we go. So I don't know what happened there. It should work now. Because it should have been working the whole time, but I don't know what's going on there. So try to go check that out now. It says, do you think that HESIs are hard? Yes, they are. Yes, they are. Most definitely they are. They are most definitely harder. And I do not like the caliber of questions at all that they do in a Hesse. Like I did not like Hesse at all. I'm trying to tell you, I did not at all because it was just dumb. Do you have any study material for nursing fundamentals? I'm struggling with oxygenation and perforation. So here's one thing I'll tell you. I'm actually working on what makes them harder. It's just the way that they ask the questions. So one thing I'll say to you is go check out nurseslabs.com and then go to their fundamental section and try that. I'm actually working on right now a fundamental section. Like I'm working on lectures for fundamentals, med surge 1 and 2, maternity and stuff like that. My course is very much in its infancy. All right. And anybody that's buying it, that's why I have it for a lifetime. So you guys get it. Right? You guys are getting it like for a lifetime. And that's why is because this isn't my course anymore. You guys are helping me build it. And I already have these things on my curriculum list. So most definitely, I'm glad you brought up the fundamentals because I am definitely doing that. I am definitely doing that. All right. Let me see something else. All right. Let me see. So, yes. I don't know what's going on with that. All right. Hold on. So let's see. Yeah, so everything should be working, Joanne. If it's not working, then I'm gonna have to troubleshoot this when I get off. Natasha says, "Thank you. You're welcome. What makes them hard?" Oh, you already answered that question. Okay, I'm a UK nurse writing the NCLEX. What encouragement you would give me? Is it Lamore Kari? I don't know how to say it. Hopefully I said that right. But the one thing I'll tell you is to don't be intimidated. Number one, don't be intimidated by that exam. Number one, okay? The perspective is it doesn't matter how many times you can take that test as much as you want, right? Surround yourself around people that are all along the journey with you, all right? And by that, understanding that, hey, you guys are all taking the same exam, but you're taking it individually, right? Don't be scared of it, all right? And also prepare. Like if you said you're going to take your NCLEX, so also prepare for it. Understand your time management. Understand your time management, your accountability, understanding where your deficits are, meaning where do you not do well at and honing in on there, right? Support groups like on Facebook, you know what I'm saying? Getting yourself a really good NCLEX course, that gives you, the things that you feel like you may need, all different types of things. But then, of course, hey, keep coming here. I give encouragement all the time. Sometimes the encouragement may be a bit ass backwards because I'm a little passive aggressive, right? But I try to be as real and as honest. Nursing is nursing is nursing. It doesn't matter where you are. Okay. I'm trying again. Okay. Natasha says, do you do tutoring? Do you do it for exams in nursing school too, or only for NCLEX? Natasha, I only do tutoring right now for NCLEX. However, I am working on some things to essentially kind of get some group coaching going on, or like, a group coaching type of deal to where, like, hey, if you're in nursing school, we can come up with something and, try to do study sessions and stuff like that. So we're working on it. We're working on it. What's up, girl? Ariana, hey. Christine says, about studying my school uses Kaplan. Our instructor said to do the QBank quizzes. What do you think? The QBank, I like Kaplan. I used Kaplan. I paid a lot of money for me to use Kaplan because I know me. You're welcome. I need to pass the NCLEX. Okay. So pass it. What do you want me to tell you? Are you tutoring for pre-nursing? User 6-3. I only tutor for those specifically specifically taking their NCLEX. But what exactly for like pre-nursing do you need? Natasha, you're welcome. Noemi says everyone needs a little tough love in their life. That's right. And I will give it to you. How do you like Archer? I think Archer's good. I like their questions. I like Archer's questions a lot. I like UWorld's questions a lot. When I coach students, that's exactly what I coach them off of. I coach them off of Archer's questions as well as UWorld. But that doesn't matter. It doesn't matter what you have. It doesn't matter what you have because I can coach you off of anything, right? It's all about how you understand the question and how you approach it. Okay, I've been studying with Archer. What's your favorite subject? What was my favorite subject in nursing school? Clinicals. It was most definitely clinicals. Graduating in 2 weeks, I have no idea where to start. Hey, you can go. Hey, if you're looking for coaching, you can check me out. That link is in my bio. But you definitely want to start with the area that you don't know the best. For me, it was pharmacology. I had to start at pharmacology, and I knew that. when I was going for my fourth time. I hammered in on pharmacology because remember, pharmacology is the second largest section on the NCLEX. Second. Inside of my course, there are 18 pharmacology videos. 18. And essentially, those were the ones, those subjects themselves, when I was scattering and looking around the internet of the important things, the important topics that you need to know in regards to pharmacology, those 18 fall within there. Pharmacology, maternity. Look, mother, baby, bro, listen, 89% women of nursing, and I'm the dude trying to figure out, like, telling this lady to push. Right. I worked in I did clinicals in labor and delivery. And let me tell you something. That's the only aspect of labor and delivery that I ever will get, because look, it's like I feel like every room in labor and delivery was like Maury, but it wasn't. But the one that I went to happened to be like that. Some young lady laying there in labor, blah, 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 and 4 different dudes in there. And I could just imagine Maury sitting in the corner with his fucking piece of paper saying, we're going to find out right now. When it comes to whatever, you are not, and then they just went down the line. I was like, okay, bro, I cannot be here. I cannot be here anymore. So, so mother, baby, because you have 2 patients instead of 1, and then pharmacology, those were the 2. And those were the pharmacology I started with first. And I just looked at pharmacology lectures, and then I just did random quizzes. And then before I knew it, good questions. High. Okay, so those are the things that can work out for you. My school uses ATI. How do you feel about it? I personally have never used ATI because I never used ATI because my school used HESI. However, I was studying for the ATIT's entrance exam. Was not a fan of that. Was not a fan of that at all. Do you have a master list of what need? Do you have a master list of what what you need to know for? And yes, I do. I have a whole, like, I don't even know where it's at. It's somewhere in here. I mean, I know. Yeah, I have a whole list inside of my head of the important things that you need to know for NCLEX. It doesn't matter if you're an RN or an LPN, because you need to know the same thing. People don't realize. Here's something I want to let you guys know. If you guys are finding value, smash that like button, okay? If you are an RN, or if you're going to get your RN, or if you're going to get your LPN, the content that you learn are the same. The pharmacology that you learn is the same. The thing that is different is what you, as the LPN, what you can and cannot do, and what you can and cannot accept. That's what it is. That's what it is. So we learn about pharmacology, but LPNs cannot do IM medication. They can't do IM pushes. They can't do it. RNs can, right? Can an LPN do a sterile procedure? Absolutely. Such as Foley's, wound care, stuff like that. Can an LPN do anything with a central line? No. Can an RN? Yes. Right? If I had a patient that was stable, can I give it to the LPN? Yes. Most definitely. But if the LPN goes and does their assessment, and then they find out that the patient's blood pressure is 180 over 110 and their respiratory rate is like 150, guess whose patient that becomes? Mine. Because you, according to NCLEX, cannot, as an LPN, have an unstable patient. And if you do have an unstable patient, what do? You get the RN. Just like if I'm an RN and I have an unstable patient, and I have all these, based off of the assessment, I have all these things. Who do I call? The doctor. Even if I have all these things that are going on, right? Sometimes they require the doctor to come in there hey, we need you in here right now, right? Just like if you're an LPN, same exact thing. It says, I am worried that too long, December to February. No. So here's my thing. I'll tell you, at minimum, give yourself 30 days if you can, if you're studying. Right? But you do not need to study no longer than 90 days. If it takes you 3 months to study for this exam, coming right out of school, first thing I'm going to be like, what are you doing? I'm going to jump straight to your accountability, and I'm going to jump straight to your time management. That's exactly where I'm jumping. Because I need to know, what are you doing? Right? I should not. Do you want to know why a lot of these NCLEX reviews are on subscriptions, and most of them are the majority of them, they have them up to 6 months and stuff, but that's mostly for when you're in school. But why they mostly have NCLEX reviews that are 90-day subscriptions? Because you don't need it after 90 days. You don't need it. That's why you see them be as low as 30 days, but as much as 90 days with an NCLEX review. Right now, I'm giving it away. I'm essentially, you get it for $97 on top of everything else I'm going to put in there. And the answer is no, I'm not going to take that away because you guys are helping pioneer this, right? That's why. But that's exactly what I would say to you. Okay. It says, how soon do you recommend take the NCLEX? You graduate 12/16. Okay. So not too long from now, but I'm thinking mid-January. No, you need to take it as soon as possible. You want to know why? Is it, Regine? Is it Regine? Did I say it right? It's kind of like, who else is Regine? Isn't Lil Wayne's daughter named Regine? All right. That's fair. Anyways. So here's one thing I'll tell you is you're in school. It's still fresh in your mind. Do it as fat. Ray Janae. Ray Janae? Can I call you Ray J? I'm calling you Ray J. Hey, come here all the time, Ray J. I got you. Ray J. Sexy, can I just party, my man? All right, I'm done. Hey, if you guys are finding value, smash that like button, okay? But Ray J. No. Rajane? Ray. What do you mean? Look, I'm calling you Ray J. Stop it. That's what your name is now. I just renamed you. I militarized, renamed you right now. You just got a name from me. But do it as soon as possible. Because the longer that you wait, the less you retain. Ray, okay, I got you. But the longer that you delay taking your NCLEX exam, this goes for everybody that's in here. The longer that you wait, the less that you retain. Because it's out of sight, out of mind. You ain't thinking about it. The back of your brain is just dumping all that information that you acquired in school. Right? So it says, no, not Ray, but that makes sense. Thank you. Are we still on this name thing? Ra. Oh, Ra. I'll call you Ra. Like Ra, sis boom ba. Bugs Bunny, Ra. Moon. That's what I'm talking about. I got you. Hey, if you guys are finding value, smash that like button. Hey, if you guys are new here, we do NCLEX questions at the beginning, right? 5:30. Monday, Wednesday, Friday. Make sure you guys are here for it. I will be here tomorrow. And we're going to do NCLEX questions. I get them off nurseslabs.com. If you guys find value to all this stuff, like I said, make sure you guys smash that like button. We do these all the time. And if you guys are still in here, I want to know who you are, where you're from, where you're at in your nursing journey. Do you answer emails and messages? I think I just saw your email come through. I see it. I think I just saw your email come through and, yeah, I don't know what's going on with that. I'll figure that out. Joanne, we will figure that out. It says, wait, what does it say? Do you answer emails and messages about the NCLEX practice after we sign up? So Joanne, when you sign up, depending on what it is, I will answer it, or 9 times out of 10, I'll answer it here if you message me. And then if you join the Facebook group, you get your questions answered over there. And also if you leave your comments inside of every lecture has a comment section. If you have a question, we can answer those there too. I graduated in September. I'm taking my exam next month. Wow. That's a long time. If you are a repeat test taker, do you recommend Remar or NCLEX Bootcamp to use for a study tool? I've never used NCLEX Bootcamp. I have my own NCLEX course, the 7-day NCLEX course that I made based off of me because I failed my NCLEX 3 times. Is it Sweet Cocoa? So Remar, I've never purchased Remar. However, I've seen Remar's NCLEX her NCLEX review. I think it's okay. Like I don't shit on it. You know what I'm saying? Like, put it this way. If I don't recommend an NCLEX course, if I don't like an NCLEX course, I won't recommend it to you. Like, at all. Just retired after 36 years. Lord have mercy. I'm 36. I don't know how that makes you feel. I'm just letting you know. But shout out to you. 36 years of what? Nursing? What'd you do? I finished my class in June and going to take my NCLEX on the 18th, and I'm afraid. Well, hey, if you're scared, go to church. How do you sign up for? Oh, so go check the link in my bio. The link in my bio, I don't know why it's not working. However, I don't know why it's not working, but it should be working. It should. If you click the link in my bio, there's a link tree. It will take you to a link tree where all the links are. It is labeled as a 7-day NCLEX course. Okay. What's the Facebook name? The Facebook name is only for the individuals that have purchased the course. I'm also done with my first year in my accelerated MSN program and can't wait to be done. I bet you can't. I bet you can't. Um, but hey, I look, trust and believe me. I was in an accelerated BSN course, and I'm letting you know right now. It was 18 months of just straight school all the time. It sucked, but you're in your MSN program, and you're gonna get it. You're gonna definitely get it. Trust and believe me. It says my favorite quote is if you're scared, don't. If you're scared, do it. Do it scared. Make me do a lot of stuff. Yeah, I bet you it does. That's why I said, hey, if you're scared, hey, regardless, you're gonna be scared. If it's something new for you, it's gonna be scary, right? It's going to be scary, right? But you still got to push through it, scared and all. Think about it when you first started to learn how to drive. A lot of people were scared when they learned how to drive, but guess what? Now you do it so involuntarily, it's ridiculous, right? I need help in pharmacology. So inside the 7-day NCLEX course, I have 18 pharmacology videos that you could utilize. They're all, and also, and all of the content videos that are in there, I have downloadable, so you guys can download the actual freaking PowerPoint that I'm going through, and take your own notes as we go along, right? What kind of nurse are you? So right now, I am a surgical slash circulating nurse in the OR. I worked ICU. I worked in a burn ICU, a neuro, and a medical ICU. Well, a medical ICU, and I floated to the neuro ICU. So I also worked in PACU as well. Who asked me that? Ra. Yeah. So that's the kind of nurse that I am. And right now I'm going back to school to get my master's degree in education. So I want to be a nurse educator. That is my want, my want and my desire on the traditional academic educational level. I'll work NICU starting February. So nervous but excited. Yeah. And here's the thing is that you're going to be nervous. And I'm telling you, your first 6 months to a year of work in there, especially if you're going to be, I think you said that you're going to be a brand new nurse, is you're going to get imposter syndrome really bad. Like you're going to be like, I don't know why I'm messing up. I don't belong here. I don't blah, 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 blah. And trust me, that is normal. That is normal for you to feel that. Okay. But be a sponge. When you leave work at work, and then, ask all the questions. Ask questions. Like there's been this trend, I guess, for decades or whatever. It's like when you ask a question, people start wanting to ostracize you and try to saying like, why do you ask the same question? Bitch, because I don't understand it. Sorry, that was a reflex. Like, I don't understand. Like I had a nurse who had been a nurse for 4 years, and I asked a question about something, and the thing that came right out of her mouth, she was like, how do you not know that? And then instantly I was just like, first of all, I didn't ask you about why I didn't know something. I'm asking you about this issue that's happening right here. I haven't been exposed to this, so can you help me? I'm sorry I had to spell it out like that for you, but you had to be so condescending. And see you next Tuesday, right? So put it this way, I had to go straight to my manager after that, just based off of like the comment, because her and I were already button heads anyway. But for the fact that you're going to talk to me and expect, like, you're going to work as a nurse, you are not going to know everything. You are not going to know everything. And you have to accept that. And when you become a brand new nurse, you have to be willing and understand that you're going to go through an imposter syndrome. You're not going to know everything, and you need to ask questions. Ask questions about nurses, nursing, all that good stuff. All right. Hey, if you guys are new here, welcome. We are doing NCLEX, talking nursing. I usually do an NCLEX, review type deal for the question that I get at nurseslabs.com. Okay. My preceptor better have the right attitude from me, because I'm not dealing with it. Hey, Ra, here's one thing I'll tell you is that you will come across those people that you will come across nurses that will flat out tell you, I'm not teaching a student. And I've literally heard nurses say that. And when I tell you, it's like I call it like a showstopper for me. If I hear it, I literally will turn around and I will be like, hey, and girl or not, I'll be like, hey, bro, so you don't want to teach a student because why? So you just know everything, don't you? You know everything. Like you just came right walking out the womb to me and like, hey, bro, I know how to titrate these drips. What? And so people that don't, like, you better have a legitimate reason on why you don't want to take a student. Like if the patient is too hard, or if you're, like if you're overwhelmed and you've not, like that's different. But for you to just be like, nah, I don't want to take a patient because you want to have a chill shift. What in the absolute hell do you think? Like you should want to start teaching. You should want someone to feed. It's kind of like raising your kids. You want your kids to be raised right. You know what I mean? And so my preset, do they still call them baby nurses? They call them baby nurses. I call them boots. I call all of my new nurses that go through my program, or I call them boot nurses. It's a military term. Going through boot camp, basic training, you know nothing about nothing, and you learn as you go. Everybody is a boot. It's a military term. All branches, they'll be like, hey, there's a boot, blah, 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 yada, yada. That's what I call them. But on civilian aspects, that's where they still call them baby nurses. I was lucky. It was my lucky day. I landed on this session on TikTok. Joanne, I'm glad that you came here. I'm glad the algorithm and people smashing the like button brought you to me. I'm glad. I like when that happens. Like that wasn't exactly like you once were not a student. Like think about that. I think about my first day on the floor, and I was just like, man, like I want to try to ease the boot baby nurses' anxiety. Like, bro, come here, I got you. And me being an instructor for so long anyway, I naturally do that. I walked around the hospital and I would see nursing students and I gravitate towards them. Like, I don't give a fuck about nobody else. Like, you could be over here and I could be a coworker. I'm like, hey, I'm going to go talk to those students. I'll be right back. All the time. All the time. Jessica says, your 7 days question bank for nurse land. What? What you mean, nurse lab? What? Oh, is my 7-day NCLEX course based off of nurses labs? No, it's not. If that's your question. My man, Jay, what's up, sir? How are you? Jay, I ain't seen you in a while. I know you out there doing your thing, sir. I know you out there doing your thing. CRNA in the making. I know you out there doing your thing, sir. Grace says, as a student myself, I let other students watch me give birth because we need to see it and learn. Absolutely. 100%. When I had knee surgery, in the operating room that I worked in, and I already knew the team. And then they was like, hey, we have a student in there, and we have two students. We have two students that are in there. We have a Navy student. Once they said Navy student, I was all for it. And then they said they had a new nurse, a new OR nurse in there. And they were just like, do you mind? I was like, yes, I want them in there because they have to learn. Not saying that they're not going to touch me, but they have to learn. They have to learn. All right. And Grace, I'm glad that you did that. Right. I'm glad that you did that because now they have to be able to see that every person can be taken care of differently. Right. Josie said, I haven't started nursing school yet, but should get in 1 to 2 semesters. Okay, shout out to you. Oh, Jessica. So my NCLEX course is not based off of nurses labs. I have harder questions that are in there that are more thought provoking. I use nurseslabs.com because they're free, but they still work. You know what I mean? So I have a new generation NCLEX review in there that does include case studies as well as multiple choice, select all that apply. And a lot of people are just like, hey, why are you gatekeeping your course? And I was just like, well, I can't, if I do this every day, I got to be able to find material and I can't just be like, hey, check this out, yada, yada, yada. So my 7-day NCLEX course, which the 7-day actual review is being created now, or it's being recorded and edited on top of the new generation NCLEX review in there, which is already in there. It has a lot of thought provoking questions, a lot of things that you would need to know. And you're welcome. And I hope that was helpful for you. Jay says, just wanted to keep up, what you're doing. Proud of you, brother. Hey man, I appreciate you being here, man. I really do. Hey man, you got to come back. You got to come back sometime, man. You got to come back. Hey, one day we're going to have to chop it up. CG says, Kevin, should I get a psych eval or should I, what? Kevin, should I get a psych eval and should I be scared of it? First of all, I don't even know what you're talking about. Kudos to you. I did my OR rotation and first thing I saw was a total knee, almost left my body. I bet the course, user 95, the course is $97. Yana says, did you work in the OR? I did. Technically the OR is still where I work. I work as an OR nurse. And I actually worked in the OR as a surgical tech. I specifically worked in general surgery. And then I started working in oral maxillofacial surgery. So I was doing breaking jaws, realigning them, stuff like that. And it says, did you work in the OR? Yes, I did. What floor experience should I get if I want to specialize in the OR? Yana, if you want to specialize in the OR, just go straight to the OR. Do not pass go. Look, go straight there. Do not pass go. Do not collect $200. Would you recommend any jobs prior to nursing that would help? Yeah, you could be a patient care tech. You can be a medical assistant, especially you can do CRNA, as well as look into volunteering. Like when you start applying at nursing schools, hey, I'm giving y'all a gem right now. Start volunteering at these hospitals. Almost every hospital has a Red Cross. Okay. Go volunteer at the Red Cross. And then when you submit your nursing application, you will usually get like a memo or anything like that from the Red Cross. Take that, submit it with your package, and then whoever's going through your packages, because I know a lot of schools are based off of points. So submit that, get extra points, and do better than the nurse, do better than the pre-nursing student that's next to you. You know what I'm saying? When we didn't have anything to do, my clinical instructor would look for places for us to go. I love the OR. Look, the OR is my home. Like I've been part of the perioperative surgical realm since 2010. I've done everything I possibly could have as a surgical tech. Like I've worked in multiple different areas. Then I started really just kind of honing in on one. And then I worked in a very specialized area of oral maxillofacial. I deployed to Afghanistan as a surgical tech, where I got to do life, limb, eyesight, emergency surgeries, stuff that I would never do, stuff that you would do in a combat zone, you would never, ever do here back on stateside, because your scope of practice is a bit expanded while you're there based off of situations. And then when I became a civilian, I wanted you know what? I'm done with the OR. I want to go to the ICU. And then what happened? I ended right back up in the OR. So, Josie, you are very welcome. Hey, what other questions do you guys have? I got about another 5 minutes that I'm going to hang out here. 5 minutes. Have you ever seen someone faint in the OR? I have. I've seen somebody faint in the OR. Wasn't me, but I've seen other people. Well, the first time I saw what I call an exploratory laparotomy, where they cut the abdomen from here to here and they open you up, I'm just like, oh man. And then instantly I kind of want to just dig my hand in there because I'm weird, whatever. You gotta be a different type of person if you want to work in the OR. Let's see. What are the pros and cons about adults versus peds OR? Honestly, it's not about pros and cons. It's about preferences, right? It all just depends, and it depends on what you do. Peds, babies are a little bit more finicky, but then with adults, it depends on whatever comorbidities that they have going on and what surgery that you have going on. So honestly, it's more about preferences, right? How can I support you financially to expand your social media to help future nurses? You know what, Jay? I don't even know, man. Like somebody asked me about, dropping a Cash App and, for support and stuff like that. And honestly, bro, until I come up with something, and I'll be completely honest with you, just tell everybody about my course. The course, the 7-day NCLEX course, is $97 for the foreseeable future for now, for a good while. And that right there truly helps support me, because it allows for me to do this every day, because I am in the nursepreneur realm. I am 100% in the nursepreneur realm, to where my goal since day one of bedside was been to leave bedside, get my experience, go find what I want to do. Education is what I want. Here's what I want to do. And this is how I want to do it. So I want to be able to get this information out to everybody. And over the next month or two, things are going to start rolling a lot different. So the course, TikTok, people coming to these, that's what will really help me right now. On the financial aspect, I don't know. Maybe I'll drop a Cash App or a Venmo that says donate to me or something like that. I'll figure something out. If I register successfully, I will promise you to 50 members at least. Joanne, I promise you, I will get you to, as soon as this live is over, I'm going to jump in here and I'm going to see what the problem is. I saw your email and I will reply to your email. I promise you that. I'm usually very prompt. Usually I don't go to bed until 2 or 3 in the morning, probably even longer than that, because I'm trying to, optimize stuff and, create ebooks and stuff like that. No, Joanne, I believe you. But, I've already created a pharmacology ebook, right? I just need to put it up. So I'm trying to find all these different avenues for y'all. And talking about everything that's going on, and even as well as give you guys updates on stuff that's going on. Like, hey, I don't know if you guys heard about this thing that happened in the news, but this lady got fraudulent. She got found guilty for fraud when it came to something about a nurse practitioner practice. All right, so I'm your number one customer, ma'am. I appreciate you. You're the first person to ever say that to me out loud. So he's like, hey, if I get in, I'm letting everybody else know. I'm like, okay, cool, let them know. So yeah, that would be super supportive and super helpful for everybody, because in the end, this isn't my course. It's not mine. It's y'all's, because you get it forever. It's y'all's, and however y'all want to build it will be like what the feedback that you guys give me to make it better is how it shall be built. I got told, hey, all you have is the content, like, where's the review? And I was like, you know what? Right. Let me pivot. And then as soon as I said that, within a month, the NCLEX, the new generation review was in there. Right. And so now people are just like, hey, what about this? Cool. Let's turn it around. And now you got that in there as well. So can you talk about being a nurse in the Navy versus being an ST in the Navy and the work-life balance? Jojo, I'm glad that you asked. So I am not a nurse in the Navy. I am a surgical tech in the Navy. Now, as someone who has been around Navy nurses his entire naval career, on top of applying to become a nurse corps officer, and knowing the tricks and trades of how to get there, and then essentially just becoming fed up and not wanting to deal with it. Here's what I can tell you is that civilian nurses, for the most part, do a lot more than Navy. No, I take that back. Let me back it up. Navy nursing is just like civilian nursing. Like, you can end up in a hospital, you get the training, but the pay is different. You get paid salary, you don't get paid hourly. You get paid as an officer, not as a nurse, right? So that's number one. Another thing about military nursing in general is that you get ample training, and I mean training all the time. All the time. Not none of this residency program where they just like, hey, you look like you're doing good, I need to get you on the floor because you've been on residency for 6 weeks. No. There's none of that. Right. And being a nurse in the Navy, it's not about being a nurse. It's about being an officer. So there's a lot, like the military is already going to expect for you to learn, or expect for you to know how to be a nurse. That's why we have the rank structure. And then you build up your rank structure. As you build up through the rank structure, you end up becoming and learning how to lead. As a surgical tech, same exact concept. It's just on the enlisted level. As a surgical tech, you're doing the hands-on stuff. As the nurse, you're not necessarily doing the hands-on stuff. And then the nurses that are in the Navy, you have LPNs, or you'll have techs, or you'll have corpsmen, right? And so they do a lot of the heavy lifting for you. A lot, literally, like a lot of the heavy lifting. So if you become a nurse in the Navy or in the military at all, don't be one of those nurses that are lazy. Trust and believe me, because once you have your corpsmen or your techs or whoever that realize that you're a lazy nurse, you'll have hard days at work. Hopefully that answered your question. But the biggest thing that's different is, like, as a surg tech, you're enlisted, and as a nurse corps officer in the Navy, you are an officer, and you have your differences in responsibilities, right? So I hope that answered your question. But Ed, yes, thank you. You're welcome. No problem. Hey, so ladies and gentlemen, that is going to be it for me tonight. Tomorrow I'm going to be back same time, 5:30. Hopefully I don't got nothing else going on tomorrow. But I appreciate y'all got me to 47,000 likes. This was a lot better than it was on Tuesday. Let me tell you, I only had barely 10,000 likes, and I think 700 people came in here total. So I was like, I'm glad y'all up in here rocking with me. But here is the last bit. Of course, check out the 7-day NCLEX course. And Joanne, yes, I know, I'm going to make sure that the link works. You guys check all that stuff out. Check out my other links on YouTube, Instagram. You guys can find me over there as well. And another thing, be kind to yourself. You only got one you, all right? And by being kind to yourself, it's just like, if you don't do well on a test, that's okay. Turn around and take it again. If you fail your NCLEX, that's okay. Pick yourself up, turn around, take that again. If you feel like you're having a bad day at work because of imposter syndrome because you're a brand new nurse, that's okay. Take it for what it is, brush it off, improve upon it, and then go on about your day. I think it's you second session. I stopped by. Look, oh, okay. You think it was the, okay, I got you. I'm tracking. So I'm glad, like I said, I'm glad that you were able to find me via TikTok. I'm really glad. So like I said, make sure you guys take care of yourself. I feel like Jerry Springer. Take care of yourself and each other, right? Like I said, last bit of housekeeping. 7-day NCLEX course. Check that out. Link in my bio. Also, if you're looking for one-on-one coaching, that link is also in my bio. It's in the link tree. Click that and it'll bring you to everything that's linked there. So until then, ladies and gentlemen, I will see everybody tomorrow at 5:30. So bye.